when I walked around, I saw a lot of pages of notes, and we're excited to see what you came up with. If on the laptops, once you wrap up your last thoughts, all you have to do is close down the browser, and that'll automatically save your notes. Thank you for contributing, and we look forward to reading what you come up with. We will get these out and post them on the summary page for this conference. So thank you again for your notes. I guess at this point I get to turn it over to Alex. So once again, looking forward to seeing what you came up with and seeing where we are next year. All right, thank you.
Moving forward to our closing remarks, it's my pleasure to introduce our next speaker, Ms. Amanda Aguirre, President and CEO of the Regional Center for Border Health and former Arizona State Senator. Ms. Aguirre, the first Latina and first woman to represent District 24, Yuma and La Paz counties in the state legislature from our area, presently serves in the capacity of President and CEO of the Regional Center for Border Health, Inc., since 1991, and its subsidiary, San Luis Walking Clinic, a primary care rural health medical center. Ms. Aguirre has been involved for more than 35 years in healthcare and business administration. She possesses a lifelong commitment to education, and in 2007, she established a licensed post-secondary vocational training center in the area of allied health training, which has generated job opportunities for over 3,000 individuals. Ms. Aguirre has built these corporations that have become multi-million-dollar corporations, providing employment for over 470 employees in a slow recovering economy. Ms. Aguirre also worked for Arizona Western College from 1995 to 1999 as a South Yuma County campus director. Ms. Aguirre has lived in Yuma, Arizona for the last 30 years, and her commitment to education is lifelong, as she was raised by parents who were both elementary school teachers. With that, please help me welcome Ms. Amanda Aguirre.
Muchísimas gracias a todos. Thank you everybody for coming today to this forum. This is the first forum that we've done in this type of setting where we have tables, discussion tables. If you remember in the past we have breakout sessions in different topics, whether it's education, workforce and education, that Linda and Mike had on all the time, and then we had the binational group that talk about public health. And then we have the engagement, community engagement, and then research agenda. And today, you all were selected to see where you are seated. So I appreciate you following that rule on the number that you've got, even in the back of your name tag. But I think this collective approach of all of you represented different sectors of what we talk about and what we've been working on. I think gives a better perspective of what we would like to do collectively from the education, public health, from the community perspective, that many of you really talk about that, as well as Dr. Bob Trotter mentioned the same way. How do we all come to put in action the things that we have been discussing? Now, a lot of things have happened because of these forums. It's not like it's just being taught. I can tell you that a lot of us, a lot of the agencies participating, from public health to NAU and Yuma, Rudy, and everybody here have gone back and we put together different actions. And the fact that you are here today is one of the successes, because a lot of the work that we're doing comes from the heart of all of us. I always tell folks that we speak from the heart. And those that truly care about what's happening to the families in this region, not just Yuma County, not just in Arizona, but our friends and families in the Mexican side, San Luis, Mexicali, Hermosillo. I grew up, I was born and raised in Sonora. I'm a Sonorense. By life, I'm a U.S. citizen. But nonetheless, what I learned in the border is that there's no border line, even though we have been divided for many events that happen. But nonetheless, the families continue united. Families continue crossing the border. The students continue across the board. And that's what makes a region so strong. Because nothing is going to separate us. We are united. And I think that you being here is what shows that drive and the passion that you all have. Because every time I talk to each and one of you, the passion comes across. Las llanteras que levantaron en el Mexicali. The amazing work that all of you in all your schools and education institutions have been doing, or in public health, is amazing. And so that comes across. And believe me, we're all committed. I want to personally thank, first of all of you for being here and make this event very successful today. Our guest speakers, they came from Phoenix, Alicia, January, a longtime friend of mine. I could spend the whole afternoon talking about all the things that we did when we were under Governor Napolitano. Amazing work. Amazing work. All day kindergarten, right? Big time. First time ever funded. And many other initiatives that started back then. But that work has not stopped. Most of all, I want to thank my staff, my IT department out there, sending all of you back there, Philip is sound director. All of them on that side too, so thank you. Alex, Mr. MC, thank you very much. That's not an easy work. Just stay over there. And my staff, Andrea, I don't know how she is. I knew executive assistant. And I present many of you there in the planning committee. Would you please stand up on planning committee to be recognized? So thank you again. Amazing conversations, and I know there's more to come. And I think you know that from us, at Regional Center for Board Health and my staff, the commitment to these communities never stop. And the more we talk about regional centers or family centers, we see our clinics always as a center. There is promotoras, there is the medical care, there is integrated behavioral health. We are in the schools, we are mobile units. We have that resources. How we can help you there, we're here. We're already in the community doing a lot of good work. And so I'm talking to my staff, we're saying, we're doing that already. We can partner with them, we can work with them and see how we can expand the concept of this family center. Family centers is how we build it up. That anywhere that family goes, has the resource and information available. So I think that's the bottom line, how we can grow healthy children, healthy minds, healthy bodies, and a healthy community with a better quality of life. Thank you again, all of you, for attending, and my good friend Nick will come here before that. Alice will introduce him. So my partner in crime, so thank you very much.
Our next speaker, Dr. Michael Sabbath, Associate Vice President and CEO, Northern Arizona University, Yuma campus. Dr. Sabbath is an Associate Vice President for NAU and Campus Executive Officer for NAU's Yuma branch campus. He earned a Bachelor of Science in Business Administration from the Haas School of Business at the University of California, Berkeley, an Master's in Public Administration from California State University, and a doctorate from the Graduate School of Public and International Affairs at the University of Pittsburgh in Pennsylvania. Dr. Sabbath was with San Diego State University for 23 years, serving as a professor, division chair, and associate dean. Prior to this, he taught in the School of Business and Public Administration at the University of Missouri-Columbia and at Indiana University, Bloomington. His research has focused on public policy and management issues related to the justice system and transitional cooperation. Please help me welcome Dr. Michael Sabbath.
Well, thank you, Alex, and thank you, Amanda. I guess I'm between you and the end of the session today, so I won't take a long time. But I did want to make a few comments. I really enjoy these sessions, and I always think, what do I get out of them? What do I take away? And, I can see 4, 5, 6 takeaways today that I really appreciated. We talk about health inequities and the social determinants of health. And coming to these sessions is kind of like driver training for me. Sometimes I forget the rules of the road and I forget some of the ideas. And so I'm reminded, and I'm made increasingly aware of the problems we face in our communities. Who would have thought? I was thinking, we talk about health inequities. No trees in our area. The health inequity, holy cow, I wouldn't have thought of that. Or, a rent burden. Or water costs. I mean, I found that interesting. And so I think one of the real benefits of these kinds of sessions is that we become aware of the kinds of issues that we do face in our community and how they impact on the health of the people in our region. One of the other things I really appreciate is the networking. I think it's so important we come together, and I can hear from state level officials about their perspectives on health and healthcare in our region. I can hear from people at the local level, from the universities. And most importantly, I think, from my perspective, we hear from our sister institutions and partners in Mexico. I see people here today, some I haven't seen in a while, and I really appreciate them. And I'm so grateful that we're able to stay in touch with UABC, with Alberto down in Guadalupe, Victoria, with US, our colleagues, with people from UES, who we're trying to build relationships with, and we're all partners here. And as Amanda pointed out, we really don't let the border get in our way. It's our population, it's our region. A lot of the issues that we focus on in these sessions transcend political jurisdictions. The air quality, water quality, and access to health care, we're all affected. We live in the same region, we share the same air, and so on. So I think it's so important. Amanda thanked most of the people here today who made this possible. I know that she would join me in thanking all of you. All of you are here because of your focus on trying to improve the health conditions in our region for the people and communities in our region. But these events would not be successful without your participation and commitment. So we really appreciate you, and let's give ourselves a round of applause. And I don't want to fail to also thank the Arizona Biomedical Research Center because they have really funded this activity for several years now. I'm amazed it's the 6th one. I get confused about how many we've had sometimes, but I look back at my old materials year before and I get on track. This is the 6th forum that we've put together. And I just hope it continues on in the future, that we find ourselves again here next year, that we're able to meet with our colleagues in the period in between to help address some of the issues and problems that we've talked about here today. I agree with Amanda again. A lot of times you don't think we make progress, but we do. I know we do. I talk with people, and some of these interventions that we put into play, social science isn't really an exact science. We can't measure every outcome and so on and so forth. But when I talk with people like Rudy and what he started with O.C. Johnson, and we see the results, 5, 6, 7 years down the road, it didn't happen overnight, and I'm not sure we could have pointed to that in the early years. And I'd say the same about education. We've done a lot to improve the workforce in the region through educational programming at the universities and through the efforts of Arizona at Work and the workforce development people. So I want to thank you all, and hope to see you again at the forum next year. Thank you.
Thank you to President Cruz Rivera. Next on our agenda is research into action. And I'd like for you to help me welcome Dr. Robert Trotter, Regent Professor of Anthropology, NAU Center for Health Equity Research and Southwest Health Equity Research Collaborative. Dr. Robert Trotter is an Arizona Regents Professor in the Department of Anthropology and a Senior Scientist in the NAU Center for Health Equity Research. His research interests include cross-cultural healthcare issues, organizational models for change, social network impacts on health and social structures, innovation, exploring advanced ethnographic methods, and translational science. He has conducted research for the World Health Organization, the Centers for Disease Control and Prevention, and the National Institutes of Health. With that, please help me welcome Dr. Robert Trotter.
Bienvenidos. I've gone totally retro. I don't have a PowerPoint for you. I have some handwritten notes that I can't read because it's in my handwriting. And I want to very, very warmly welcome everyone to this 6th annual Yuma County NAU ABRC Community Forum. I'm going to give a couple minutes of history for the forum and then give you a charge to go through the rest of the day. One of the themes for this forum is turning talk into action. We get a lot of talk. And fortunately, we also get some very professional, very impactful action. Hello. Is that better? Okay. Around 6-7 years ago, around 2016, 2017, a small, intrepid group of people from NAU who were involved in initiating the health research focus for NAU out of the Vice President for Research office and out of the Center for Health Equity Research. And you'll hear more about CHER in the very near future. The group contacted folks at NAU Yuma and folks in the community to look at opportunities for binational and border health research initiatives. And it was the outreach was based on a kind of theme that Arizona, and especially the border areas of Arizona, were tired of health research invasions, where people came in and told us what we needed and how we needed it and where we needed it, and they left out the voice of the community. So we partnered with the administration at NAU Yuma and with faculty there and with the Regional Center for Border Health Initiatives, with Campesinos Sin Fronteras, with the County Health Department, to basically say, wouldn't it be nice if people listened to us? Wouldn't it be nice if our voices were heard, our collective voices were heard? And out of that initiative and out of the conversations with many of the leaders in health equity in the region, we actually were successful in getting a grant from ABRC, from the Arizona Biomedical Research Commission. At that point in time, it was a state commission. It has transformed into the Arizona Biomedical Research Center, which is funding a lot of different initiatives. But their funding allowed us to come together and to put together forums in Yuma that brought together all of the stakeholders to talk about what are our needs. Not just research needs, but action needs. And how can we create collaboration, and how can we create both border and cross-border kinds of initiatives that make sense for the local community, that aren't some vision from outside, but a vision from inside. And so consequently, we received the funding for these forums. This is the 6th forum. And I want to emphasize that the previous 5 forums are kind of a transition from our original discussions of wouldn't it be nice if they listened to us, to what are our needs and what are our resources and who do we need to collaborate together. And one of the one of the voices that came out of this were all of the forums. And one of the things I want to point out to you, this is a transitional forum. This is really taking talk into action. And you've seen it with the posters that were presented last night. You'll hear it with all of the talks today. But I want to, because it's gotten kind of lost, I want to point out that there are 5 executive summaries of the original forums. They focus on health, border health research needs. They focus on workforce development. They focus on international collaboration. And they are a very effective blueprint for turning talk into action. And Amanda, I'm sandbagging you a little bit. I think it would be great if the participants could receive all 5, or at least receive the information that they need to get to all 5. Each one has incredible detailed roadmaps for action. And so that is, okay, all of that is a bit of the past. And in the interim of this 6 to 7 years, we were rudely interrupted by COVID. And we were inconvenienced like crazy, and we persisted. And so that original momentum plus the intervention of COVID is a part of this whole blueprint. And I think it's a magnificent kind of blueprint for action. I want to, okay. If you visited the poster session last night, or if you didn't, go see it today. Because one of the things I was struck with all of the different posters is that they clearly address all of the 4 critical issues that each of the forums have talked about. One is workforce development. You heard President Cruz-Uribe talk about some of the initiatives there. You heard Amanda talk about their initiatives for workforce development, and those are direct actions out of the basic principles. Second, research, but research on local needs that are driven by local priorities. And in part of the posters, you saw interventions for youth, which has always been a high priority in these forums. You saw interventions for monitoring locally important diseases rather than nationally important conditions that may or may not seriously affect the local population. You also saw community collaboration in the posters, which has been a critical theme throughout these forums. And you saw the binational collaboration that has always been a prominent element of these forums. So one of the things I want to say is we've come a long way. We have a blueprint. We have collaboration. And so it's time to stop talking and turn on the action. So thank you very much.
Thank you, Dr. Trotter. Next, we have Mr. John Garcia, Arizona, from Program Director from the Arizona Biomedical Research Center, Arizona Department of Health Sciences. Mr. Garcia currently serves as the Program Director at the Arizona Biomedical Research Center. He earned a Master of Business Administration with an emphasis in Information Technology Administration from Ashford University, now University of Arizona Global Campus. Mr. Garcia also completed a Bachelor of Arts degree in Management with the University of Phoenix, including foundational coursework from the University of Arizona. He also received a certification as a public manager through Arizona State University. Mr. Garcia joined the Arizona Department of Health Services about 2 years ago. His career in government spans over 40 years. Please welcome Mr. John Garcia.
Good morning. Welcome to this wonderful conference this morning in sunny Yuma, Arizona. And want to extend my thanks to Northern Arizona University for hosting this conference. Also to shout out to Dr. Steve Palmer and especially the local hosts with the organizations there in the Yuma community. Just a little bit about the Arizona Biomedical Research Center. Just wanted to do a little overview. We were established in 1984 to provide grants to organizations for conducting research on diseases caused by tobacco. And this funding originally came from a portion of the proceeds of a lawsuit that was brought against the tobacco companies back in the 80s. And then later, that was changed to the taxes that were levied on tobacco products. The organization was originally called the Arizona Biomedical Research Commission. It was a standalone organization with commissioners, and then they made the decisions on a day-to-day basis of the funding for grants that went out to the different organizations that applied. In 2011, the commission was moved under the Arizona Department of Health Services. And then in 2017, the commission was dissolved and the name was changed to the Arizona Biomedical Research Center. The scope also changed at that time to fund research for a wider variety of diseases that affect Arizonans. And then we were also given proceeds from lottery revenue to fund research education programs such as this, and also the Arizona Public Core Book Program This program is designed to seek the donation of umbilical cord blood from expectant mothers after birth, creating a painless transaction that takes the leftover blood that's in the umbilical cord, and that can be used for treatment of over 80 diseases and the 80 diseases, and also for research. The mission of ABRC is to accelerate biomedical research, education, and innovation to benefit Arizonans. The ABRC's executive director is the State Laboratory Services Bureau Chief, Dr. Victor Waddell. And then myself as the ABRC Program Director, I provide the day-to-day direction and guidance with the assistance of a Deputy Program Director, Yuma, a contract administrator, a grant program administrator, and 2 cord blood interns. Overall, we give out over $9 million in grant funding every year, and about $1.5 million in funding for research education, and another couple of $1 million goes to the cord blood program. So we are dedicated to doing everything we can with the limited funding that we have. I kind of say it's limited because I think we're actually winning the fight against tobacco use. At least looks like it from the revenue side. Our revenue is going down about 2% a year. So I think that that would tell us that fewer people are purchasing tobacco products. Unfortunately, I think there's more need for us to study the effects of vaping and on especially young people, and so that we can explore this area further to determine the dangers that might be related to vaping different substances. So anyways, I want to thank everyone for coming today, this morning, and for putting this great little conference together, especially every year. And I wanted to especially express my gratitude to the local organization, especially Andrea and the group from the Regional Center for Border Health, the San Luis Walk-in Clinic, and all of the great work that you guys are doing down there to promote public health in the Yuma region. Also, shout out to our friends who are joining us from Mexico. Bienvenidos a todos. Welcome to Arizona, and I hope that you will enjoy your stay and enjoy this conference. And I'm going to turn it back over to our host for the day. Thank you very much for coming.
Dr. Julie Baldwin is the NARBA Institute Vice President for
Good morning. I hope everyone's doing well today, and I'm so sorry.
Not yet. Vice President for NAU Health, the Executive Director of the Center for Health Equity Research, and a Regents Professor in the Department of Health Sciences at Northern Arizona University. She earned her doctorate in Behavioral Sciences and Health Education from the Johns Hopkins Bloomberg School of Public Health from 1994 to 2004, she served as a tenured faculty member at Northern Arizona University. Dr. Baldwin was recently inducted into the National Academy of Medicine as a citizen of the Cherokee Nation of Oklahoma. She has made a lifelong commitment to serving diverse communities and to advocating for health promotion programs for children, adolescents, and families. Please help me welcome Dr. Julie Baldwin.
Good morning. I hope everyone's doing well today, and I'm so sorry that I can't be with you there in person. Unfortunately, we have another major event here at NAU that I'm hosting, so hope to be there next year. But my name is Julie Baldwin. I am the Narbut Institute Vice President for NAU Health and the Executive Director for the Center for Health Equity Research. And what I wanted to share with you a little bit today is talking about addressing health disparities and healthcare needs in Arizona, and specifically through our Center for Health Equity Research and NAU Health, some of the activities we're involved in. So first of all, the Center for Health Equity Research has been established since 2016. Our mission is to collaborate with communities to build foundations and environments that support health and well-being. And our vision is to be a trusted partner and leader in research and action to attain the highest level of health for all people. You might ask yourself, what is health equity? Well, health equity is the assurance of conditions for optimal health for all people. And to achieve health equity requires valuing all individuals and populations equally, recognizing and rectifying historical injustices, providing resources according to needs, and hopefully if we're able to do those things, we will eliminate health disparities and achieve health equity. Health equity involves every person in every sector. And so not just the healthcare system per se, but education, public safety, social environment, transportation, housing, the physical environment, employment, and income and wealth. All of these factors influence health equity, and sometimes they're referred to as the social determinants of health. In our Center for Health Equity Research, we have a number of different research priorities. We do research in the area of chronic disease prevention, looking at cancer prevention and treatment, diabetes, obesity prevention. We also have several projects focused on infectious disease prevention, including COVID-19 and HIV/AIDS, a number of studies looking at maternal and child health, and a few in environmental health in indigenous country. And then several programs focused on behavioral health, including substance use disorder, mental health, and even suicide prevention. We have one or two projects focused on oral health, and then a few focused also on disabilities. In our Center for Health Equity Research, our strategy is to support health equity in Arizona. And we do this by diversifying and strengthening the health workforce in key areas, building strong partnerships and community engagement around health, hopefully strengthening our infrastructure here at NAU and our ability to be able to engage in meaningful research, and then being able to translate the research back to communities in a way that's meaningful to them so that the research really provides direct benefits to our citizens. Just one example of one of the projects that we have that is directed by Dr. Nikki Tufelshoen is called the Center for Native American Cancer Health Equity, or CNACHE. It was established in December of 2022, and this was through an award for from the American Cancer Society to Northern Arizona University. The main goals of this project are to reduce the unequal burden of cancer and advance cancer health equity for Native Americans with a focus on cancer screening rates, access to cancer care services, exposure to cancer-causing environmental contaminants, or researching that. And these are the three research projects specifically that are a part of CNACHE. We have one project focused on environmental exposure from legacy mining that's led by Dr. Jenny Ingram, one on Navajo Cancer Work Group Informing Policy and Care that's led by Dr. Dirk DeHeer, and one on cancer screening among Native American women with disabilities led by Dr. Daryl Joseph. Another project that we have that's directed by Dr. Sam Sabo is called Hearts in Action, and it's a workers' right toolkit by and for workers and the community health workers who serve them. The overall goal of Hearts in Action is to implement and evaluate a brief community health worker program to address work as a social determinant of COVID-19 and its sequelae among 50 rural Hispanic Latino low-wage essential workers employed in agriculture, housekeeping, restaurant, or home health. We also have a very large center grant that's funded by the National Institute on Minority Health and Health Disparities called the Southwest Health Equity Research Collaborative, or CHERC. And the overall goal of CHERC is to increase basic biomedical, clinical, and behavioral research here at NAU to be able to address and promote health equity among diverse populations in the Southwestern United States. We recently were refunded in 2022, and for the next 5 years, these are our main goals. We have 5 different cores. So our administrative core is focused on increasing capacity for an effective and sustainable RCMI and to support our investigators here at NAU and also in our communities to address health disparities and advance health equity. We also have a research capacity core that's focused on providing methodological, statistical, and informatics support for our investigators to maximize the quality and productivity of all of the research. Our investigator core fosters research career enhancement and development with a special emphasis on working with underrepresented faculty and early stage investigators. And then our community engagement core engages our community members and leaders and organizations, policy experts and researchers in relationship building, accountability, action, and reflection to enhance our community assets. And finally, with our recruitment core, we will be recruiting 2 faculty members with established health equity programs to NAU and support their research. We have 3 main research projects that are involved with CHERC. One is led by Dr. Ricky Camplain, and that focuses on gender differences in physical activity opportunities and impacts while incarcerated. Another program is led by Dr. Emily Cope, and that's on the evaluation of soluble fiber as a strategy to decrease asthma morbidity in underserved populations. And then our third project by Dr. Joe Mihaljevic focuses on integrating analysis of subpopulation dynamics to help us understand more about improving spatial models of infectious diseases. We've had several key accomplishments in our CHERC program since 2017, so we've been operating for about 7 years now. We've had over 43 research projects funded through the center. 8 of them have been full, larger research projects, 26 pilot projects, and 9 supplements. We've had 115 faculty and postdocs across 5 different colleges in 29 departments. And then we've seen a tremendous return on investment. So for example, of the 20 grants that we've funded through the pilot project program, that has led to 58 different external grants worth over $21.4 million. There are early stage investigators leading 86% of these awards, and 16 of these awards have been NIH grants worth over $11 million. We also have a very active community engagement core, as I mentioned earlier, that has developed and implemented and disseminated Fairness First campaign, where we have talks and a blog, podcast, etc. And we're doing a number of other types of activities with our communities across the state. And something we're very proud of is that NAU is projected to achieve R1 status in 2025. And we feel that that's largely attributable to the RCMI grant. So now I'd like to turn a little bit to some of our new initiatives through NAU Health. And to start off, just kind of explain a little bit more about why NAU Health, and this really stems largely from previous work that's been done by the Arizona Board of Regents and others looking at some of the healthcare gaps in the state. So we know through this analysis and report that Arizona's worker to population ratio is below the national average for all professions in health except for pharmacists and chiropractors. In interviews and external data that have been conducted, we have found that Arizona's rural counties experience greater challenges recruiting and retaining healthcare workers. Arizona has fewer hospital beds per 1,000 population than the national average, and public health funding is considerably lower than the national average. It's also estimated that nearly 3 million Arizonans have limited access to primary care, and more than 1 in 3 Arizona hospitals face a critical staffing shortage. This is just another slide that indicates our healthcare professional shortage in Arizona and the gap. And unless action is taken, the annual growth in all Arizona healthcare professions over the next decade is projected to slow. And so according to the ABRC analysis, these are the numbers below of professionals that are needed by 2030 to fill these shortages. And I won't read through all of these, but you can see that they're quite significant, especially for nursing and physicians. The at-risk compensation report that was also conducted by ABRC found that as of 2022, Arizona had 37 federally designated medically underserved areas and 11 identified medically underserved populations. And while provider shortages are acute in rural and tribal areas of the state, especially, there are designated underserved areas in every Arizona county. And additionally, each Arizona county has a designated health professional shortage area, which are federal measures of unmet healthcare needs, including a lack of access to care. So in total, there are 682 federally designated HPSAs across Arizona, including those in primary, dental, and mental health designations. This is just a map also illustrating where the primary care HPSAs are. And you can see the darker colors indicate the greater shortage areas. So especially in our rural parts of the state and also where tribal communities may be residing. And this is true for both primary care, and then on the right, you can see for mental health. So this is why we feel it's so critical, and it was important to launch the NAU Health Initiative. And the overall goal of NAU Health is to improve health outcomes of Arizona's rural and underserved communities by doubling the number of healthcare profession graduates and launching a College of Medicine to address the critical need for primary care physicians. As you can see, here's a little bit more detail about the College of Medicine. We hope to create accelerated pathways and affordable options. We want it to be teaching focused with an integrative curriculum, including behavioral and physical health, and very much partnership driven. We also now have a new College of Nursing. We previously had a School of Nursing, so it was elevated from a school to a college. We are also strengthening partnerships and alumni relations and expanding development opportunities. And then we also have a strong focus on behavioral health as well. We hope to really develop new program locations and modalities, whether it be through certificate programs or degree programs, and also strengthen pathways with community colleges and create more interprofessional programming among all of these areas, as well as create credential programs and residency programs. Specifically for the College of Medicine, we are embarking upon a 3-phase process. So phase 1 has already occurred, where we brought local and statewide stakeholders together to discuss the context, support, and partnerships that will allow NAU Health to achieve its goals. And then next week, we'll be meeting with our national members to share outcomes of phase 1 and to obtain advice and recommendations that would be specific to what we hope to do for NAU. And then phase 3 will really be working with our community partners throughout the state to develop the foundation for a system strategy for NAU Health by building a map of stakeholders, their priorities, and the exchanges that are necessary to create a successful College of Medicine. With the first stage that we conducted in April, we developed a vision that was cast by our advisory group. And these were some of the main types of indicators we're looking at and factors that we're exploring with the College of Medicine. So looking at different health outcomes, healthcare markets, the workforce, economic development, the importance of community trust, health and engagement, specifically thinking more about our student population, the curriculum that we're going to develop, the care models. Very important component is sustainability, and then this whole process of really designing the medical school. This is our current timeline, which really only takes us up through September, but our goal will be, after we conduct our National Advisory Committee meeting next week, to start conducting some more interviews, focus groups, listening sessions throughout the summer to really try to incorporate more community input in this process. We will be developing a report for our president by July, and then that report will go to the Arizona Board of Regents in August. So we hope to have more information for you after August about the development of our College of Medicine. And with that, I want to thank you very much for this opportunity again to present. I'm so sorry that I couldn't be there in person, but I encourage you to contact me. Feel free to reach out if you have any questions at all. Here's my contact information, and I look forward to talking with you soon. Thank you so much.
Moving on to our next session, health equity agenda. Our first speaker will be Ms. Alicia Jacobo Kenny, Bachelor's in Social Work Justice Reinvention Program Manager, Office of Health Equity from the Arizona Department of Health Services. Ms. Jacobo Kenny is a Justice Reinvestment Program Manager in the Office of Health Equity. Alicia is a proud seventh-generation Arizonan. This is her first stint in public health as she joined ADHS in the fall of 2021 after a long career as a social worker. She is excited to oversee the Justice Reinvestment Programs funded by Proposition 207, including expungement of marijuana and education outreach. Alicia has also enjoyed serving on the Health and Safety Officer bench and supporting team members in this capacity. Please welcome Ms. Alicia Kenny.
I love it when people pronounce my name correctly, so kudos for that. As you heard, I'm Alicia. I'm the Health Equity Program Manager with the Office of Health Equity at ADHS. I've been asked to present today on our Arizona Health Improvement Plan, which is led by ADHS. And I think what's important is a lot of us think about equity and value it, feel it's important, but we don't always have the tools that we need to implement equity. So along the lines of what Dr. Trotter said this morning, I'm hoping to provide you with some tools so you can take that talk into action. The Arizona Health Improvement Plan, also called AZHIP, reflects the commitment of ADHS and our partners to improving public health across Arizona. The 5-year plan was released in 2021, and we updated it this past fall. We're currently in the 4th year of implementation. The AZHIP Steering Committee, which was comprised of multi-sector leaders within public health, finalized the 5 priority areas, which are health in all policies, social determinants of health, mental well-being, rural and urban underserved health, pandemic resiliency and recovery, and health equity. So I'm going to speak specifically to health equity today. The health equity priority has 3 strategies, and under those strategies there are additional tactics. The strategies include strengthening data infrastructure, informing, integrating, and sharing, community partnership and engagement, and policy systems and environmental change. I'll be focusing on the strengthening data infrastructure priority and share a few tools that have come out of the AC HIP priority and also the Office of Health Equity. So the first tool is our data visualization toolkit. This is a quick and easy guide that can be used before, during, and after the creation of a data visual, like a chart or an infographic. It ensures the information that you're sharing aligns with health equity. So I'll mention a few of the factors, but they're all listed on the left-hand side of that document. And you can find the toolkit on our health equity webpage, which is shared at the end of the presentation. So let's start with community engagement. We've heard a lot about that today. But when you're sharing data, it's just as important to engage with the community as when you're working with them on other things. So ideally, you want to partner with the community to create your visual. You want to ask the community, what do they think is important to share? Do they have additional data that they'd like to share? And are you or your entity really the best person or place to be sharing that data? You'll want to take into consideration the colors you're using. Colors should be used to draw attention to highlight the data and stay away from alarming colors because they can indicate danger or negativity. When using labels, use person-first language. For example, rather than saying the homeless, you want to say persons or people experiencing homelessness or those who are unhoused. With regards to images, images should represent the makeup of the community that is being represented in a dignified way without perpetuating stereotypes. And most importantly, do not talk about disparities without naming their causes. People typically consider a social or economic disparity as a personal or individual failing or problem. This results in blaming or stigmatizing a group of people. We know that disparities exist because of the social determinants of health and system-level inequities. So don't rely on the data alone. Be sure you provide that narrative that explains why the inequity exists. This leads people to believe that a systems change is necessary and possible. Next, I'd like to share our recently released Arizona Social Vulnerability Index, or the AZSVI. This is an exciting tool that's been developed by the AZHIP Data Advisory Committee. The committee consists of individuals representing over 50 organizations, such as local public health, healthcare, nonprofits, tribal entities, and universities. The committee has and continues to provide insight to ADHS on how to implement data projects with equity. So I'm sure a lot of you are familiar with the CDC's Social Vulnerability Index. The CDC SVI brings together many different factors to estimate places in greatest need during an emergency. So just for a quick reminder or an overview, social vulnerability refers to potentially negative effects on community caused by external factors or stresses on human health. These external stressors are listed here with their related factors listed below. So there's socioeconomic status, household characteristics, racial and ethnic minority status, housing type, and transportation. The SVI ranks each census tract on a scale of 0 to 1, and 1 is representative of the most vulnerable community. This is an index number that is relative to all other census tracts in Arizona, takes into account all the factors at once, and is an estimate. The CDC SVI was created using a national level analysis, not accounting for Arizona-specific conditions, which leads us to the Arizona Social Vulnerability Index. The Arizona Social Vulnerability Index takes into consideration additional factors like our diverse population demographics. Arizona's population is exceptionally diverse with significant presence of Native American, Hispanic, and immigrant communities. These diverse cultural groups can face distinct health challenges related to cultural practices, language barriers, and socioeconomic factors. We've also taken into consideration climate and geography. So most of us know that we live in a very hot climate. So it takes into consideration the geographical features such as the desert, extreme temperatures, limited water resources, and potential for wildfires, which can pose health risks. There's rural and urban disparities within our state because of our mix of urban areas like Phoenix and Tucson and our vast rural regions. Health determinants can obviously vary significantly between these areas, affecting healthcare access and availability of services. We also have substantial Native American populations where many tribal members reside on reservations. These communities often face challenges related to healthcare access, infrastructure, education, and economic opportunities. Socioeconomic and education factors also exist across our state, and these can influence health outcomes with lower income populations facing greater challenges in accessing quality health care and leading healthy lives. As we all know, Arizona is rich with cultural diversity, but this also brings unique health practices and beliefs which can affect healthcare utilization and outcomes. Cultural competent care is essential in addressing these determinants. So we've taken these additional factors into consideration and added a fifth theme unique to Arizona, and that's what you see in the red. After talking with the Data Advisory Committee and pulling additional stakeholders, 9 factors were identified as the most important to consider for the Arizona theme. The 9 factors include rent burden, food insecurity, population density, environmental factors like air quality, tree coverage, and heat vulnerability, plus healthcare access, water costs, having a smartphone. A team of statisticians and experts at ASU found data sources to use for these factors. So unfortunately, I can't show you the actual tool, but this is a bit of what you'll see when you go to the Arizona SBI on our website. So this is the example of the Arizona theme. Those census tract in the darkest red are the ones that are most vulnerable. And when you zoom into specific areas, you can see more detailed information. So this particular, you'll see the state of Arizona, and then I zoomed into a specific census tract. For whatever reason, I thought Yavapai County instead of Yuma County, so forgive me. But this tells us in Census Tract 14.02 in Coconino County that 13% of the housing units charge rent that is more than 35% of the renter's household income. Almost 10% of all households receive SNAP or supplemental nutrition. 87.6% of the land is not covered by trees. 26% of households do not have a smartphone, so we presume that means they don't have access to the internet. And it would take approximately 86 minutes to get to the nearest medical facility. So the Arizona SBI is an awesome starting point when determining which communities may need services or programming, but it's really important to keep a few things in mind. That this tool does not replace the important work of going into the community, of listening and working with them to understand what they need. And also the Arizona SBI can be a helpful starting point to open the door for more conversations with the communities. It's also important to remember that living in an area that has high vulnerability doesn't necessarily make someone inherently vulnerable. and that there are data limitations, especially for rural and tribal communities. I'd also encourage you, if you're looking on the website, to visit about the data, because that will help you understand what data sources feed into the factors. And also, we will share with you how you can download the data for your own use. We've also included stories from community members. These individuals share about the challenges they have encountered in accessing the resources they need for a healthy lifestyle, and they've highlighted their remarkable strength and innovation to address their healthcare challenges head on. So you can find the Arizona SBI on the Health Equity webpage at ABHS's website. And you're also more than welcome to contact our Office of Health Equity if you'd like us to go through a short demonstration with you. The AZ-HIP Health Equity Priority also focused on the creation of a community engagement toolkit, which is available for others to use. They also created a data collection to advance health equity fact sheet, and these tools are all available on the AZ-HIP resource page. There are also additional tools around policy that can be found there. The Office of Health Equity has also created a number of tools that can be used both by internal staff and external partners. So I encourage you to take a look at our website. One tool that we've used a lot internally and encourage external partners to use is our accessibility toolkit. This focuses on making materials accessible to the disability community. We also have class training, culturally and linguistically appropriate services training, which I'm sure you're familiar with. That's available. And then last, we have our equity partner list. The intent of this list is to provide contacts for Arizona or for ADHS staff so they can build relationships throughout all communities and corners of Arizona. We email information about funding opportunities, resources, conferences, and a lot more. So if you'd like to join the list, feel free to click on the QR code and complete the form and you'll be added to the list. So I'd really encourage you to check out our webpage, as we have a lot of other tools around things like language access, which includes interpretation and translations, also with regards to American Sign Language. And we also have information about equitable hiring practices, and then resources for smaller or grassroots organizations so that they can have a better opportunity of applying for state funding. We're constantly building new tools and resources, and we're always adding them to our website. And that's all I have today. Thank you, and have a wonderful day.
Thank you. And up next, we have Ms. January Contreras, who is the President and CEO of the Children's Action Alliance. Ms. January Contreras is an attorney and nonprofit executive who has championed women and children for more than 25 years. January is currently the President and CEO of the Children's Action Alliance, which is the leading policy advocacy organization focused on the well-being of children and families in Arizona. January previously served at the national level as the Assistant Secretary for the Administration for Children and Families at the U.S. Department of Health and Human Services, a presidential appointment for which she received bipartisan support in the U.S. Senate. As the Assistant Secretary, she managed federal programs ranging from child care to Head Start to child welfare and safety net services. Please help me welcome Ms. January Contreras.
Thank you and good morning. Yes. I barely made it. Anyone noticed? Because I live in Phoenix and I forgot my makeup. So I was out looking for a Walgreens. I went all the way to Target. And I haven't really seen the finished product. So hopefully this looks okay. So I'm so glad to be here, especially because Amanda Aguirre invited me. And anyone in this room who knows Amanda Aguirre knows what a leader she is for Arizona. She has been in elected office. No one wanted her to stop running, but she felt this passion and calling to build in a place where not enough building was happening to make access happen to healthcare for people who live here and all the people who come. I look at all those houses and I know that it wasn't here the last time I came out here. I have a friend who was married in San Luis, so this is probably 25 years ago. That is the last time I've been here. And the growth is pretty amazing. So I do want to acknowledge the leadership of Amanda Aguirre, who had a vision and doesn't stop working any single day to make this a reality with all of you. Round of applause. I think in this room is a wide variety of folks who, you have shown that leadership for yourself and for your own community, trying to create greater access to healthcare, students, people who are in academia, leading in education, and trying to bring solutions forward. I'm January Contreras. I am fifth generation Arizona. My family is from southern Arizona, Nogales and Bisbee. And I've had this privilege of really serving kids and families for a long time. I started working for Janet Napolitano, if anyone remembers her, when she was the governor years ago. And I've had this, like Amanda and like so many of you, really just wanted to be a part of making a difference, wanting to build, wanting to help community. And that has led me down a very, very amazing journey professionally. Most recently being asked by President Biden to serve as the Assistant Secretary for the Administration for Children and Families, leading a $62 billion budget. They led everything from child welfare to child care funding, Head Start, safety net programs, refugee resettlement. So we have a lot going on. And when I wanted to come home, I didn't know exactly what I wanted to do, but I knew that I wasn't done working for kids and families, especially in Arizona where we still have so much building to do. And so now I'm so proud to be the president, the CEO of the Children's Action Alliance. It is the leading children's advocacy organization. It's been around for 35 years. Focused very heavily down at the Capitol and with the governor's office and state agencies. Heavy emphasis around healthcare, around child welfare, safety, around early childhood, child care, preschool, education, and also economic well-being. So trying to build back that safety net that so often in Arizona there's a tendency to try to dismantle. So my team put together this one page that hopefully you have a copy of, and if you don't, we'll have more. Just to give a sense that this is sort of a zooming in on how are kids doing here in Yuma County, in this area. But I think what is universal about kids right now, there are some exciting things and there are also some things that are troubling. And I'm sure in another part of the conversation and in your work, for example, even when we're talking about physical health and immunizations and healthcare coverage, we are increasingly talking about the mental health of young people. In my last position, we really were going gangbusters, just trying to pull together to identify solutions. We worked very closely with SAMHSA, we worked very closely with HRSA. We worked very hard to put funding together. How do you get it in the hands of community like is assembled in this room? How do you get, hundreds of millions of dollars passed through Congress at the federal level, and then somehow create a grant process that is smart enough to get it into the hands of people in this room who know your community, who know young people, who know parents and families in ways and can create space where people are comfortable for coming for services. one thing I saw in my work at ACF was mental health services could look different all across the country. There were places where they didn't use those words, mental health. That was not a term that would be welcoming necessarily for the youth or the families that they serve. And so you might see something called a family circle, or you might see something called peer support, or you might just see, direct services like happened in this building right here, this beautiful building. The data on that I didn't include here. It's really sobering though. The presence of social media, the still coming out of the worst of the pandemic, this loneliness now being talked about as an epidemic, and how young people are dealing with that. And so I just urge us all to continue to think about that no matter what work we do, because that is clearly something that our young people are really talking about. That not only that their feelings are stressed or anxiety or these things, but also that, the hopelessness of thinking about, is their life worth living, which is just such a very, very difficult thing. And I know from this last work, every state, every city I went to, parents wanted to talk about that, even though they never thought they would be. And that's one of the things I think that helps people come together on that. Almost all of us in our families, in our neighborhoods, in our communities, in our churches, we know that young people need community to come together to solve that. I did put some other info on here, though. Of course, starting with healthcare, given all the folks that are assembled here. When we're talking about healthcare coverage, as an example, Arizona, we are still in the bottom 5 states in the country. In the US, when it comes to how well we have health insurance for kids, whether it's private or public, we're still in those bottom 5 states. But we used to be last. So I say, good job, Arizona. We're not last. We're excellent. I mean, you look at that 96%, compare it to the statewide rate, and you know that that's community working together to make that happen. I want to talk about child poverty rates. Many of us watched during the pandemic. I have to say, one of my hopes during the pandemic was that when we all, no matter our political party, when we witnessed how true it is that any family can be in a crisis at a moment's notice, that we would come to understand why the safety net is so important. There was a lot of investment at that time. There was investment into childcare. There was investment into a lot of, rental assistance, mortgage assistance. And one of the things that was really important that happened during that time was the federal child tax credit. So people may remember that. That is a tax credit that, actually people got checks. They just got the checks in the mail, and they made a big difference for families, and they really made child poverty rates go down. So, this is good news. We do see that the percentage of children in Yuma County living in poverty is the lowest in years. That's exciting. We do see a lot of job growth in Arizona. Actually, our job growth is exceeding most of what's happening in the country even. And yet we still have a lot of work to do in terms of that compared to the country, compared to the state. Housing costs, this is a bummer, right? Housing costs, because I know when I was growing up, that was the reason people moved to Arizona, right? My husband and I, we bought our first home for $103,000, and it was a great, great home. That's getting tougher and tougher to do. Our first apartment was $400 a month, and it was 2-bedroom. I mean, we were splurging there. We don't see that anymore. And so this housing cost is a real big part of what's holding families down a little bit, just putting weight on their shoulders, feeling like they can't get ahead. we see, I know in my family, a lot of families sharing homes. I mean, doing what they have to at the moment to save up to be able to move to the next place. And so this is an issue that, even though we're talking about healthcare, we all know the social determinants of health. We all understand how all of these very basic needs for humans are connected. And housing is one, and the stress that comes with not being able to put a roof over your family's head, or the stress of having to choose, what are you sacrificing when you're paying that rent or that mortgage, and what you're not able to provide for your family. And so I don't want to not miss that, because it is a really important policy issue in terms of we need solutions. We need to get the brakes, like really slam the brakes on what's happening, and start to, get back to a place where individuals and families can find housing that works for them and that they can afford. There's a lot of attention on what's called the rent burden. So when you're renting, the ideal standard out there is that rent should not cost more than 30% of our income. And we see increasingly that that's not a reality for a lot of families. So this is what we're talking about in this section of that paper. Again, we are seeing solutions out of the state government, so it's one of those areas where I have heard legislators and certainly the governor speak across party lines. Last year we saw hundreds of millions of dollars put into the Affordable Housing Trust Fund, which is a very important investment, unprecedented in Arizona. And also just a few weeks ago or a month ago, the governor announced a mortgage assistance program. So these are the kinds of solutions that we need to keep seeing more of so that we're really tackling this issue. Talking about education, Yuma, you must feel a lot to be proud of. I know when I drove into town and I saw right there the ASU, U of A, NAU campuses sign, I thought, wow, that and AWC, that's very exciting that education is so present and in your community. And I think that's a good model for all communities as we look at that. So, graduation rates for high school are something to be proud of. Now 89% of students here are graduating within 4 years. So that's ranking Yuma County as the third best in the state. And I know not everybody here lives in Yuma County, but it's a great example of, again, what happens when you have community come together to focus on issues to support young people, to support education, to support families. These things don't happen on their own, I know that. So these are just some of the things that we wanted to highlight for you in terms of how our kids doing. What we know is that I talk a lot about the links between the well-being of kids and economic well-being because it's just undeniable. When you see a family that is economically stressed, you see higher anxiety, stress, depression among young people. Depending on what our environment is out there, our job as the responsible adults is to try to create the supports that are there for families and kids, that to try to create an environment that tells every child, you are welcome here, you have all of your God-given potential to do everything that you want to do, whether that's to work in a hair salon or whether that's to be a teacher or whether that's to be a dentist, whatever it is, that we can come together to create those supports. And I think here, and especially when you have communities where you have to drive between, it is great to see that there are links. That doesn't mean we don't have work to do here and throughout the state, we certainly do. But there's a lot to be proud of in terms of what you're doing for your young people, how you're supporting them, how you're setting them on this trajectory of having options, right? And you do see a lot of focus on the workforce, on education, and those are things that are important to young people to realize those options as well. So thank you for allowing me to be a part of your day. I'm so happy to be here, and my time is up. Thank you.
Thank you, Ms. Contreras. And before we proceed to our next speaker, I just have to take 1 minute to brag about San Luis Walking Clinic, because Ms. Contreras was mentioning a little bit about immunization rates in Arizona. And last year, the San Luis Walking Clinic received the Association of Immunization Managers Champion Award for our immunization rates in Yuma County. So I just wanted to bring that. Our next speaker is Dr. Daniel Dirksen. Dr. Dirksen is the University of Arizona Health Sciences Associate Vice President for Health Equity, Outreach, and Interprofessional Activities. He is a professor in the University of Arizona Melanina Zuckerman College of Public Health with joint appointments in the Colleges of Medicine and Nursing. Dr. Dirksen was born in Phoenix, attended University of Arizona for both his bachelor's and his doctorate in 1984, and did his family medicine residency at the University of New Mexico in 1987, where he was then on the faculty for over 25 years. Please help me welcome Dr. Daniel Dirksen.
It's great to see everyone here this morning. This picture is one I took at Catalina State Park, just outside of Tucson one evening. I was walking my dog and a little snow flurry came in. I'm hoping it'll make, we do a calendar each year in the Center for Rural Health. I'm hoping it will make, one of the months there. So if you do have cool pictures of Arizona, especially outdoor stuff, we do have a little contest for that. So, all right. Let's do it this way. So I'm going to talk about some of Arizona's real health challenges. This has really been set up well by Alicia in January, so thank you for that. But I also want to talk about some innovations and opportunities that we have as a state. Because while it's one thing to look at some of those things we're not so proud of as far as, kind of trailing other states in a lot of things, I think there's a lot of things we could be leaders in and are leaders in. And one of the ones I'd say we are a leader in is, we talked about this a little bit last evening during the reception with Priscilla, was that, our Arizona long-term care system, our Arizona Medicaid program, our kids care programs, to me, are models for the country. We've been really lucky, I think, with the leadership we've had and really the innovation with limited resources. So that's me a little bit, my bio. I want to talk about some of the activities I'm doing because it'll lead into some of the things I'm going to highlight during my remarks with you. Informing legislative, regulatory, and program policy. A lot of the data visualizations that you heard about and some of the tools that you'll see on the Arizona Department of Health Services now are really very useful, especially as you're writing grants, trying to get more resources in from the federal government or foundations to help advance the things you're interested in, like some of the research projects that we saw last evening in the poster session. So I think that informing with data those deliberations is really important. Expanding community-based experiential health professions training. The Regional Center for Border Health houses the Western Area Health Education Center. It's a regional center. We have 6 regional centers in the state. I oversee, in my role as a associate vice president, is the AHEC program, and then we work with the 6 regional centers, including the one that you're in today. And then assuring a well-trained and distributed health workforce. I'm a family physician by training. I believe that when you train people in areas of need, they're much more likely to go into practice there. When you recruit people from areas of need or from areas that haven't had enough health professionals, whether it be nursing or pharmacy, nursing home, other staff, you're much more likely to have those folks go back into practice where they grew up or they have family ties. And then improving access to health care and health insurance coverage. You heard some of the challenges that we have, but also some of the opportunities, and I'll go into those. So Those are some of the things. I want to highlight because there's a lot of activity going on. We anticipate some action this year, but a lot of action at the federal level. In fact, the Health Resources Service Administration, HRSA, announced a maternal health initiative in January. And Arizona is going to be one of the first states that they're going to really come and visit with us when we do our 50th Annual Rural Health Conference at the High Country Conference Center, NAU. So they're going to have a special session on that. They're going to invite a group of folks to help plan for how we could roll this out and really be part of the solutions for some of our challenges. And I want to point out one. This is one that we're not so proud of in Arizona. We shouldn't be so proud as a country either. If you look at the United States as far as maternal mortality, and this is done as the number of deaths by mothers within 42 days after delivery. There's something coming up on Zoom here. Thank you. Thank you. We're compared to 38 other developed countries. We're twice the rate of maternal mortality per 100,000 versus other developed countries. That's not something we're particularly proud of. And then if you look at Arizona, we're even worse than that. So there's a lot of work to be done. If you get outside of some of our more metropolitan areas, the access to labor and delivery services is kind of appalling. So if you had a baby before, a multiparous woman, and you go into labor, it can be an hour and a half before you can reach a place that actually does deliveries in our state. And that, I think, contributes to some of not only the maternal mortality statistics that we have, but also the infant mortality. And if you talk about something that permanently scars a family and friends and all that, it's these kind of tragedies, often which are preventable with adequate access to maternal health care services. So that's where we stand today. I hope this is the last time we see a number like this as we start to really invest in this as a state. If you look at some of the areas, and if you look at the 2 areas without any labor and delivery services, you know, we only have 15 counties in Arizona. We're the 6th largest state in land area. Our counties are pretty big. They're bigger than a lot of states back east. So La Paz County, Greenlee County have no labor and delivery services. And then there's a couple over there in Graham and Cochise that are really on the brink. We saw this also in Santa Cruz County, where they had 3 physicians that did OBGYN, obstetrics and gynecology, and then they got down to 1. And when you're on call every night, 24/7, that can wear you down. So there's been some things done the last session and hopefully this session to address some of those services that serve enormous geographic areas, but much more can be done. Now, I learned early on when I did Health Policy Fellowship with Senator Bingaman from New Mexico as a Robert Wood Johnson Health Policy Fellow. You know, I went in and he asked, well, what do you want to focus on during your year with us? And I said, I want to work on health workforce areas. And I started to show some of these, you know, kind of alarming statistics. And he says, that's all fine. I want to hear the solutions. Let's start drafting legislation. And we went through 100 versions with Legislative Council. And about 95 pages got introduced as a bill, which he introduced. And those 95 pages were cut and pasted and put it into Title V of the Affordable Care Act. And now they're federal law. So there's things you can be done. Sometimes you just happen to be in the right place at the right time, like I was with Senator Bingaman. But these are really important issues. And now's the time that we got the attention of the federal government. We have a very receptive governor and governor's office and some of the agencies that you're hearing from today. They really want to make some of these things, let's lead the nation in the improvement in these types of things so that we can really stop these tragedies from occurring. I'm so glad, Alicia, that you went into the Social Vulnerability Index, because I think this is an incredibly useful tool, along with the other acronym that you heard today, the HPSAs, the Health Professional Shortage Area. There's 3 of them. There's primary care, there's mental health, behavioral health, and then dental, and we're not so good on any of those. But the highest score you can get is 1.0, and I put some in there, and it's probably hard to see from where you're at, but the highest score, and these are all social determinants, which you heard some about, and Alicia's taught, is 1.0. And a lot of our counties, especially those counties right along the US-Mexico border, you know, over 300 miles of border that we share with our neighbors, we have, you know, they're in the 0.99 in some of these. So these are some issues that we really have to get at. We're starting to measure this now in the billing and collections, like for example, that we do with Medicare and Medicaid. So I think there's some hope for this. The other thing that I thought January might mention, but our community health workers now have a whole set of codes where they can bill and collect for Medicaid. You know, we've lost some enrollment to Medicaid, but there's still 2.2 million, you know, Arizonans enrolled in Medicaid, and community health workers, community health representatives in our tribal areas can really help expand our reach and make sure people get the care they need when they most need it. So I find this a useful tool. The combination of the social vulnerability index that now we have for Arizona in combination with the health professional shortage areas, those two can really help us target our policy and workforce interventions. These are the areas that most need our help. I think a lot of course, I'm an educator. I've been in you know, education for many years, health professions education. I think we need to move the wonderful education that people can get in places like Phoenix and Tucson and maybe Flagstaff and a little bit in Yuma. Let's get it out to the areas of need so we have a wonderful balance working with our community colleges, working with our health professionals in hospitals and clinics, and really make sure that wonderful education you get in the large urban areas is really enhanced by the education you get in community-based experiential training. There's an acronym for that, CBET, that you'll see a little bit more of. Let me turn to the second case. So as Arizona's physician workforce, we spend quite a bit of time on this. We're only meeting about 40% of our primary care need. You see this in a lot of different ways, but we're 42nd in the number of primary care physicians we have per 100,000 population. We're 14th in population of the states, so we're a lot short. We're 31st in total physicians, so I tried to get in to see my dermatologist. You know, I lifeguarded and taught swimming lessons in Arizona during the summers, so I, you know, like a lot of you, you're vulnerable to skin cancers and things. It was 6 months to get in a dermatologist in Tucson. I mean, it's not just the primary care, it's not just the nurse practitioners, it's pretty much across the board. So we have a lot of work to do, but we have a lot of opportunity too to make this happen. And I'm going to get to this. There was a thing in Arizona Central, the Arizona Republic. Arizona will never solve its doctor shortage if we don't fix this, and I'll get to that, what the answer to that is. But here's the other metric that I was talking about, the health professional shortage area. This one, the highest score is 25. Almost all of our tribal communities are in the 20s. So we put a few of those there, and then there's a number there of how many full-time equivalents in primary care physicians it would take to eliminate that shortage designation. And so again, we can use this data to help really guide where we need to do our health professions education, but also where we need to create tools, incentives, maybe a tax credit for folks that stay in a health professional shortage area, or a loan repayment program, or some of the other things. So it's not just recruitment, it's also retention, but also let's remove the barrier to people pursuing health professions careers. No matter what the health profession, and I remember this quite well, how much you go into debt to pursue your life dream of getting trained in a health profession, whether that's nursing or pharmacy or medicine or other health professions. It's too darn expensive. And you know, when the state underinvests in K through 12 education, kindergarten through 12th grade, but also underinvests in higher education, guess who carries the burden? It's the students themselves. And we see the tuition going up and becoming more unaffordable. And I think our goal is, if we're really going to address one of the major social determinants in our state and our country, it's educational attainment. We know people are healthier and our society does better the more we can get people along in education. We did get some policy gains in this recently. There is a scholarship program at the colleges of medicine, Phoenix and Tucson, for those that agree to come back after they do their residency training and work in a health professional shortage areas. And then we just got this, and this started in September, the American Indian Health AHEC Regional Center. that Governor Hobbs signed into law. This is something that Kim Russell, we're 3 years on it. It took 3 years to get through the legislature. Finally went in, and Jeff Axtell is the executive director of the American Indian Health Regional Center based out of Flagstaff. So that's very exciting. We're very hopeful that that's really going to help us recruit health professionals that really reflect the diversity of our diverse populations in Arizona, especially from our tribal communities. Another one is in graduate medical education. So after you go to medical school or osteopathic school, that's usually 4 years. You have to get your residency training, which is 3 to 7 years, neurosurgery 7 years, to be able to practice, to get your specialty. Like I'm a board certified family physician, you have to do residency. Again, we rank 14th in population in Arizona of all the states. We're 37th in number of residency slots we have. So while we do have enough undergraduate medical education, medical students and osteopathic students in Arizona, and with the growth you heard about with NAU starting one, with ASU starting one, and the other ones we already have, we're okay on the medical and osteopathic school slots in Arizona, and that will really track very nicely with the growth of our state, because we're one of the fastest growing states in the United States. It's the residency afterwards. So a lot of our graduates in medical school, osteopathic school, have to go outside the state to get their residency. And guess what? 80% of them don't return to practice here. So if we can create enough residency slots so we can keep our graduates in the state, we'll do better as far as addressing our workforce shortages. You see different numbers. This is stuff from Health Resources Service Administration. Right now we need about 1,100 residency slots to be at where we should be for our population today, and that'll be almost 2,000 by 2030. So we have a ways to go, and there's some things that are happening to make this happen, including here in Yuma, and some of the things Amanda and her team are doing to really expand residency education. The two subsidies for that come from Medicare and Medicaid largely. And in our state, we're actually, this is something I think is quite good. We're number 5 in Medicaid graduate medical education. So we've been very creative in our state, I think, leading edge in how we subsidize that education. What I'd like to see from the Centers for Medicare and Medicaid Service, a little bit more help so we can have our federally qualified health centers, our rural health clinics, and our critical access hospitals be sponsoring institutions. There's a couple of federal barriers there. There's a couple of things we can do, I think, at the state level that would really help us advance this to get to where we need to be. So Governor Hobbs last year, at about this time, signed into law. It didn't go into effect because the budget didn't come out until August, and it's 90 days afterwards anyway. But this $5 million came out, and you're starting to see now more technical assistance going on. Charlie Alfaro and Ed Paul are helping with that. You'll hear more about that if you attend the Rural Health Conference at the High Country Conference Center June 4th and 5th. Actually, June 3rd, they're doing a pre-conference just on graduate medical education. And then Amanda's been a leader for many years in our AHEC regional centers. This is the Western Arizona Health Education Center, and they serve a large area in blue that you can see there. But we have 5 others. I mentioned the American Indian Health that just started in September, which is very exciting. They're focusing at the moment for one kind of sandwich between Pima County and Maricopa County and Pinal County, the Gila River Indian community, and then also San Carlos is going to be an area of focus initially. You know, there's 22 federally recognized tribes in Arizona, and it would be a bit much to expect the American Indian Health to focus on them all. But like here, there's a lot of work being done through the Western Area Health Education Center, the Regional Center for Border Health, for the tribal communities in this area, as you've seen. And I think Cocopa is going to be doing a meeting here soon. So that's also exciting. And one of the things I want to highlight, this is another data visualization, is that there's almost every state has an AHEC program. So University of Arizona Tucson's the program. There's 6 regional centers, like 250 regional centers in the United States. So the 56 AHEC programs in the country, Arizona is doing 12% of the community-based experiential training. We do a lot of community-based training. This area does a huge amounts of this. North Country, another federally qualified health center system in the northern part of the state, does a huge amount. I don't think we quite beat out North Carolina because they do a lot of community-based experiential training, but we're in the top 2 or 3 as far as that goes, and we'll need to do more. And I think this is part of the solution to our health workforce shortages, is that we do more of our training in communities that really need the help. We want to make sure that the people who grow up in those communities do well if they apply and get into the health professions education. How do we make them successful so they matriculate and go out? How do we make it affordable? How do we create the incentives to keep them there through tax credits or loan repayment or whatever once they do get out, so that we're really growing our own in our own communities. And I think we have a good infrastructure to do this that we can leverage. This is just another way of looking at community-based experiential training. 26% of the rotations that I mentioned, over 3,000 rotations that occur, are in rural areas. 2/3 are in primary care settings, and 2/3 are also in medically underserved communities. So this is community-based experiential training. It's because of our 6 AHEC regional centers and our 9 rural health professions programs. And the rural health professions programs are at the 3 public universities. So University of Arizona has 6 health sciences colleges. Northern Arizona University does their PT, their PA, and their what used to be School of Nursing, now it's the College of Nursing, I understand, from the presentation earlier today. And then the Edson College of Nursing at Arizona State University. This has been a big deal. This is in state statute, so the Rural Health Professions programs and the Area Health Education Center, regional centers, all work hand in hand to make these happen, and that's been extraordinary. I don't think this gets as much, kind of credit for what actually happens out in community and health professions education. Medicaid, we hit a little bit on this. January talked a little bit about this. In the United States, this is a little concerning. There's at the high point, during the public health emergency, we had about 94 million covered between the dual eligibles, the Children's Health Insurance Program, and Medicaid. And we lost about 22 million in enrollment across the United States. So that's a pretty big number. Most of those disenrollments were procedural reasons, not because the people don't qualify anymore, because they don't meet the income thresholds, but because they didn't fill out the right form, they didn't turn it in on time, other things that come up. So one of the things that's concerning is for safety net providers like here, someone who's self-pay or charity care, uninsured, that really puts an undue burden on the rural health safety net around our state. And so everyone who's eligible for Medicaid, we want to make sure is enrolled. Everyone who's eligible for Medicare, we want to make sure gets enrolled. I've been tracking this each month, and there's a nice dashboard. I'm going to say, in New Mexico, our dashboard wasn't as easy to navigate as it is in Arizona. So the tools you saw, those are really helpful. But we've gone from a high of 2.5 million during the height of the public health emergency before the redetermination process began. We're now at about 2.2 million. About 300,000, a little over 300,000 lost coverage, and almost 100,000 children. And so it's about 12.5%, but I've been trending the last 3 months, and it looks like we're starting to go back up again. So we've hit, the estimates when this started was that we'd lose about 500,000. And we never got close to that, which is good. So we seem to be planing out now. The people who are eligible are getting enrolled. More and more people are realizing that this needs to be done. And one of the really good pieces of news is we had a record year for the other provision in the Affordable Care Act. One of the important ones was expanding Medicaid to 138% of the federal poverty level. But the other one is Marketplace and making that affordable. And we had a record year. We went up by almost 50% to 350,000 people. Now, because of the permanent reauthorization of the Indian Healthcare Improvement Act as part of the Affordable Care Act, people up to 300% of the federal poverty level, if you're American Indian, can qualify for Affordable Care Act coverage. If you're up to 138%, of course, Medicaid, 138% to 300%. No co-pays, no deductibles for marketplace coverage for American Indians in our state. So really, we're at about 10% uninsured overall for our state, a little higher than that in tribal communities. We should be at 4 or 5%, especially in our tribal communities. Maybe overall for the state, we could get to 7%. But of the 10%, about 750,000 to 800,000 Arizonans of our 7.3 million total population. So 750,000 Arizonans without health insurance, half would qualify either for Medicaid or marketplace coverage with significant subsidies. So we could do a lot better than we're doing, but it takes a lot more education and outreach than what we're doing now. So if we don't make up ground on the Medicaid, it just puts this undue burden on our critical access hospitals, our rural health clinics, our federally qualified health centers, and our Indian Health Service and tribal operated sites. But it also puts a burden on our private practices around the state and all that, because really what we want to do is make sure that every person who's eligible gets the coverage that they can get. For those who aren't eligible, I think we could do a lot of things to make it more affordable. So do you want to know more? Do you want to do more? There's my little animation there. And so this is my shameless promotion for our 50th annual Rural Health Conference. So that'll be, again, on the NAU campus at the High Country Conference Center. They've always done a nice job for us. June 4th and 5th. There'll be some pre-conferences January 3rd, one on graduate medical education, one on maternal health, and another one on really geared for the rural critical access hospitals and the rural health clinics. And so we're excited about that. I just checked this morning, we're at about 260 registered right now. I think their capacity is around 300 to 350. So if you might want to visit the website. There's the thing. If you just Google Arizona Center for Rural Health, you can sign up. I know some of the folks here are going to be presenting, and a lot of the folks that have been involved in this part of the state have helped us with the conference agenda. I think you'll find it useful, and like this, it's really important to develop those relationships. And it's always nice for us anyway, and I would suppose in Yuma as well, to get up to Flagstaff in June. As things tip above 100 degrees, that's a nice refuge. So I really want to thank you all for participating today and being engaged in all this, and hopefully we'll see you at our 50th annual Rural Health Conference in Flagstaff. Thank you.
Thank you, Dr. Dirksen. We're going to take a few questions if anybody's interested for any of the speakers that have gone so far. If there's any questions, I'd be happy to bring you the mic and you can ask your questions. Seeing as there are no questions, we will move on with our program.
Well, good morning, folks. I just wanted to mention something about the poster sessions downstairs, and we need your input on something. So the poster sessions came from the research working group, as we were talking about, hey, what is happening? There was a tremendous focus on, hey, here's what is happening here. There's a lot of amazing research. So those of you that have posters downstairs, can you raise your hand just to say, thank you for bringing that research here. I hope you all get a chance to go visit and talk with them about what they learned and what they're doing. Most of those posters are actually from our partners at our Mexican university, so thank you all for coming. So a round of applause for those folks. You will end up seeing a QR code downstairs to actually put a vote in for our priority area for discussion this afternoon. So this afternoon we're going to have roundtable discussions. There are so many things that we could focus on, and that work will continue. However, we're hoping today with your vote, we identify one focus area that we spend our time discussing this afternoon. So as you read through and talk to our scholars downstairs, if you could vote, find the QR code and scan it with your phone, and the sheets will look like this downstairs. If you could find those and vote on your priority areas, your input will guide what the discussions will be this afternoon. So, thank you very much. Look forward to seeing what you all have to say.
Okay. So please help me welcome our next speaker, Dr. Armando Moreno Soto. Nació en Nogales, Sonora, un 27 de agosto. Dr. Moreno Soto es licenciado en Economía por la Universidad Autónoma Metropolitana, Unidad Xochimilco. Cuenta con una maestría en Comercio Exterior y Aduanas por la Universidad de Sonora y maestría en Ciencia Económica por el Colegio de Ciencias y Humanidades de la Universidad Nacional Autónoma de México. El Colegio de Sonora le otorgó un doctorado en Ciencias Sociales y en la Universidad de Sonora se ha desempeñado como docente por más de 38 años. Ha ocupado cargos de coordinador del programa de licenciatura en Economía y coordinador del programa de maestría en Comercio Exterior y Aduanas en el Departamento de Economía de la misma universidad. Ayúdenme, por favor, a darle una cordial bienvenida al doctor Armando Moreno Soto.
Buenos días a todas y todos. I can't read in English and understand when somebody speaks slowly, like I can speak. Entonces voy a hablar en español. Muchas gracias por esta invitación. Pertenecemos a una misma región. Con todas las asimetrías del desarrollo, pertenecemos a una misma región. Incluso, como se puede ver aquí, hay mucha gente de origen hispano. Entonces, quiero agradecer especialmente a la Universidad del Norte de Arizona, al Departamento de Servicios de Salud de Arizona, al Centro de Salud de la Frontera, el Centro Regional de Salud de la Frontera, por la invitación. La Universidad Estatal de Sonora es una universidad relativamente joven. Nació en 1983 aquí en San Luis Río Colorado, como CESUES, como Centro de Estudios Superiores del Estado de Sonora. Acabamos de cumplir 40 años. Tenemos una población de 15,000 estudiantes, un poquito más de 15,000 estudiantes, en 5 zonas regionales. Está San Luis Río Colorado, Hermosillo, Magdalena, Benito Juárez y Navojoa. Una de las características que tiene la Universidad Estatal de Sonora es que tiene mucho estudiante de origen indígena, especialmente, por ejemplo, en el sur. En el sur, donde están la unidad de Navojoa y Benito Juárez, tenemos en Benito Juárez más del 70% es de origen mayo. Viene de las pequeñas comunidades mayos. También en Navojoa, incluso son mayor la cantidad de estudiantes de origen mayo, aunque proporcionalmente, porque es una unidad más grande, son menos. Otra de las características que tenemos es que ustedes saben, la geografía de la pobreza y de la vulnerabilidad en Sonora es muy parecida a lo que ocurre a nivel nacional, en el sentido de que en el sur del país están los más pobres de los pobres, y en Sonora los pobres de los pobres están en el sur, donde nosotros tenemos 2 unidades regionales. También hicimos una extensión en algo que se llama el poblado Miguel Alemán, que está a 50 kilómetros de Hermosillo, que de poblado no tiene nada, es una pequeña ciudad de obreros agrícolas, de gente del sur que llegó al trabajo agrícola y que muchos de ellos se quedaron ahí. Entonces, fluctúa entre 40,000 y 50,000 habitantes, muy pobres, muy pobres. Entonces, eso es una de las características que tenemos. Tenemos muchos estudiantes de origen de pueblos originarios. Donde menos tenemos es en San Luis y aquí llegan algunos Cucapá. Es donde menos tenemos. Y tenemos mucha gente muy pobre. Entonces nosotros en salud tenemos 3 licenciaturas y acabamos de abrir una cuarta. Originalmente teníamos fisioterapia, teníamos enfermería y nutrición. Y recién en enero abrimos medicina general y comunitaria. Nos trajimos un programa de la Benemérita Universidad Autónoma de Puebla para generar ese programa, para poner en marcha ese programa. ¿Por qué? Porque el problema médico en Sonora, me imagino por las cifras que acaban de dar, que es algo parecido aquí, el problema está en la zona rural y en las zonas pobres. La gente que está saliendo de la medicina normal, digamos, de la medicina de especialidad, se queda en las ciudades. Entonces lo que nosotros hicimos fue traernos ese programa y no escogimos a los mejores estudiantes en términos de la calificación. No dijimos, a ver, van a entrar los que tienen de 98 de promedio adelante, sino que tuvieron un buen promedio, pero que sobre todo tuvieran corazoncito social, vocación social, para que se queden en las zonas rurales, para que vayan a las zonas rurales, para que vayan a las zonas pobres. Entonces tenemos esas 4 escuelas de licenciatura, ¿no? Como les digo, medicina recién puesta en marcha, con 35 estudiantes originalmente. Entonces, nosotros estamos en un proceso de transformación de la universidad, en términos de varios aspectos, pero en términos educativos, vamos por una idea que yo la capté en la Universidad Autónoma Metropolitana, Unidad Xochimilco, de donde egresé como licenciado en Economía, que era vincular la docencia, la investigación y la extensión en el proceso de enseñanza-aprendizaje. La idea me pareció, cuando yo la leí, muy genial por mi formación filosófica de entonces. Entonces, porque el argumento es, la docencia es mera reproducción de conocimiento. Cuando uno va al salón de clase y es muy buen maestro, es que sabe explicar muy bien y pone en contacto al estudiante con el acervo de conocimientos. Pero no puedes crear nada en el salón de clases. La investigación es creación de conocimientos. Y la extensión es aplicación de conocimientos. Entonces, vincular la docencia, la investigación y la extensión en el proceso de enseñanza-aprendizaje es vincular la producción con la reproducción, con la aplicación de conocimientos. Entonces, para nosotros, eso es vital, en eso estamos. Incluso si uno se pone a averiguar la historia de la ciencia, así es. La ciencia no existe porque a alguien se le ocurrió ideas geniales, sino porque cuando la humanidad se encontró con problemas prácticos que tenía que resolver, pues creó la ciencia. Por eso es que las primeras ciencias son la astronomía, la matemática, la geometría, que era lo que necesitaba la humanidad para afrontar los problemas de una sociedad agrícola. Entonces, y vuelve a la práctica. Entonces, queremos hacer una transformación en ese sentido. Tal vez para ustedes les parezca extraño lo que estoy diciendo, pero si uno ve la historia de las universidades latinoamericanas, todas nacieron y durante años solo dieron docencia, solo dieron clases. Mucho tiempo después que se creó la investigación y el patito feo es la extensión. Entonces nosotros estamos por la idea que el doctor decía, ya basta de pensar, ya basta de ideas, lo que se necesita es la acción, la práctica, ¿no? Se necesita ir a resolver problemas. Nosotros partimos en un plano más general Todos sabemos que el problema de la salud no está aislado del problema del desarrollo. Necesitamos crecer económicamente, desarrollarnos, y dentro de ese contexto está la salud. Nosotros le apostamos a un modelo, y me refiero al actual gobierno federal mexicano, a un modelo que sienta, o sea, piensa que la clave para desarrollar el país es una alianza. Una alianza entre los sectores productores, entre el Estado, las universidades. Cada quien aportando elementos fundamentales. El Estado, la infraestructura física y humana, las carreteras, las presas, toda la infraestructura. Los empresarios, el empleo. Y nosotros, las universidades, generando cuadros cada día más capacitados técnica y profesionalmente, con ética, que en nuestro caso en México es muy importante la cuestión ética, por el papel tan nefasto que ha jugado la corrupción en nuestro país. Entonces, la ética, investigaciones pertinentes que incidan directamente y además intervenciones. No quedarnos nada más con contemplar el problema, sino entrar a solucionar los problemas, en colaboración, claro, con el Estado y el sector social. En ese sentido, hemos incidido mucho en esa vinculación más fuerte con la sociedad. Voy a darles casos así de tipo de lo mucho que se está haciendo. Por ejemplo, en el área de la salud, todos los edificios nuevos son de la salud. Todos los edificios nuevos de la universidad son de la salud. El último que nos falta es el de San Luis Río Colorado. Y en todos esos edificios de salud no solo están los laboratorios, sino están los consultorios. Les voy a poner, por ejemplo, el mayor éxito en ese sentido ha sido fisioterapia. Por ejemplo, en el caso de fisioterapia, imagínense Benito Juárez. Benito Juárez está entre Obregón y Hermosillo y es una ciudad pequeña que se nutre de puras comunidades indígenas. Sus estudiantes vienen de las comunidades. Entonces, por ejemplo, que ahí esté el consultorio de fisioterapia es una gran ayuda para la gente. ¿Por qué? Porque si no estuviera ese consultorio, ellos se tienen que ir a Navojoa o a Ciudad Obregón. El costo del transporte, el costo de la alimentación y 600 pesos que les pueden cobrar de una consulta. En cambio, ahí se van a la unidad de nosotros en Benito Juárez, les cobran 100 pesos. Y para nosotros es un gran aliviane en el sentido de que nuestros estudiantes no solo están en la teoría, sino comienzan a estar en la práctica. Claro, con la asesoría de un maestro, pero ya están trabajando en la práctica. Desde que son estudiantes, aprenden más, van más capacitados y además ayudan a la comunidad. Así como hay las brigadas, por ejemplo, en el área de la salud, hay algo que se formó en Navojoa, que son brigadas a la comunidad. Se juntan en un camioncito y se van enfermeros, se van fisioterapeutas y se van gente de nutrición a trabajar a las comunidades, a dar asesoría y consulta en las comunidades, naturalmente apoyados por los propios docentes, ¿no? De esa naturaleza, o por ejemplo, otro típico ejemplo, hay un internado en Hermosillo que se llama la Cruz Gálvez, que tiene más de 100 años. Se creó en la Revolución, después de la Revolución, para atender a los hijos de huérfanos de la Revolución. Entonces llegamos, por ejemplo, después de la pandemia, y es un edificio histórico, muy bonito. Y están los niños ahí, entonces nos enseñaron, por ejemplo, una sala para enseñar inglés, mejor que la que nosotros teníamos, pero sin maestros. Y nosotros tenemos licenciatura en la enseñanza del inglés. Pues que se pongan los estudiantes a enseñar inglés a los niños, usando todo ese, así. En horticultura tiene un terreno, pues a enseñarle a los niños a sembrar hortalizas. En ecología, que tenemos licenciatura en ecología, pues a sembrar árboles, a enseñarles a cuidar los árboles de esa naturaleza. Incluso de los más ambiciosos proyectos que traemos son impactar en el desarrollo regional. Voy a ponerles un caso. En Magdalena de Quino tenemos una unidad y recién fundamos una escuela de horticultura. Yo soy originario de Nogales. Yo nací en la frontera, yo nací en Nogales, Sonora, aunque he vivido en muchas partes de México, pero ahí viví y viví de joven también ahí en Nogales, Símbolis, toda esa región. A mí me interesa mucho esa región. Entonces comencé a plantearle a los presidentes municipales que había que hacer un desarrollo en términos de frutales y hortalizas, que es la alternativa después del Telecán para México. No puede competir en granos. Entonces comenzamos a trabajar y lo primero que nos encontramos es la contaminación del río. Las aguas negras entrando a los arroyos. Entonces, y tenemos ecología y tenemos ingeniería ambiental. Pues comenzamos a trabajar en mejorar las condiciones del arroyo para poder sembrar hortalizas. Entonces, termino esta idea con algo fundamental para nosotros. Para mí es una obligación de la universidad pública que la mantiene el pueblo de Sonora, el pueblo de México, servir al pueblo de México y servir al pueblo de Sonora. Pero va más allá de una cuestión meramente ideológica, es una cuestión práctica. Dice que el sentido popular, que la práctica es la maestra de todo. La práctica es la maestra de todo. Mientras uno le están enseñando rollos y rollos y rollos, no aprende. Hasta que uno los hace, aprende. Entonces necesitamos que nuestros estudiantes aprendan y que además aprendan también a tener corazón social, a tener solidaridad, porque finalmente la solidaridad humana, el amor a la humanidad, ha sido la fuerza motora para que llegáramos a ser la especie superior de la naturaleza. Agradezco profundamente cuantas veces ustedes nos inviten, aquí estaremos y con mucho gusto, y pues hagamos esta alianza porque finalmente, como iniciamos, pertenecemos a la misma región independientemente de las disparidades del desarrollo. Muchas gracias.
Gracias, Dr. Moreno Soto. Our next speaker will be Dr. Yimin Wang. Dr. Wang serves as Vice Provost for Global Affairs. In this role, Dr. Wang provides leadership for university-wide international education and global engagement strategies.
My name is Yimin Wang. I'm Vice Provost for Global Affairs at Northern Arizona University. That means I'm actually not a health professional. When I got my doctorate in the field of education, in Chinese language, the background is in Chinese language. Doctor actually means medical doctor or health professionals. I taught my mom that I got my doctorate, and my mom, who lives in China, who is a health professional, asked me. And in the 10 years after that, she has been asking me, when are you going to be a real doctor? Because she's a real doctor. Yesterday I taught her, I said, okay, I'm not a real doctor, but I'm going to present at the Medical Professions Conference, the Real Doctors Conference. Guess what she said? How dare you? Okay, the reason I'm presenting here is I hope to provide some models and meaningful ways that we can co-create international partnerships with your universities, with your organizations, and with our industry partners. During the past 10 years at Northern Arizona University, we have been really focusing on different kinds of the international education models, internationalization. But really it was during the past 2 years, we have been really focusing on our collaborations with Latin American countries, and especially in Mexico. which is not only because of our internationalization goals, but also because of NAU's Hispanic serving institution goals. Of course, as a university in a border state, this is what we have been focusing on. This is one thing that we can brag about. 2 years in a row, both in 2022 and 2023, NAU was recognized as one out of 43 Fulbright Hispanic Serving Institute leaders. So we have been currently hosting quite a number of Fulbright scholars, Fulbright students, Fulbright specialists from Mexico at NAU. So this is one of the resources here. I know many of you here are researchers from Mexico, so this is one thing that we can explore together. And here are some institutions that NAU has partnerships with. These are just examples. If your institution is on this list, we can certainly explore more kinds of partnerships, anywhere from on-site programs, degree programs, short-term training, exchange programs, hybrid programs. When we say partnerships, we not only mean university-to-university partnerships, we also mean that university-to-industry partners, and with community organizations, and even with individuals. This is my second year presenting at this conference, and last year after I presented, not only multiple universities reached out to me, and so that we can build meaningful collaborations together, but also community organizations and also individuals. Individual researchers who already have a degree from Mexico who wanted to have some kind of collaboration or have their degree maybe in a way articulated with the courses, with degrees within Northern Arizona University. And every time after we have a conversation, there are good partnerships, meaningful partnerships that we can generate together. Before I get into different kinds of models, I want to give you one of the examples. A couple years ago, NAU secured this 100,000 America Strong grant. This is actually the third time NAU secured this grant. This grant is specifically for American universities to collaborate with universities in Latin American countries with health professions as one of the key areas. This specific time, the grant we got was really in entrepreneurship and sustainable development. What we did was to really think about sustainable development in broad ways, from environmental sustainability, policy-related sustainable development, and economic sustainable development. With all that, we started with industry and community. We organized a group of researchers from multiple universities in Mexico and in Northern Arizona University. And each of those researchers, faculty members, had their own students. And then we worked with community organizations and industry both in Sonora and in Arizona, and asked questions: what are the real problems that a group of bicultural, binational researchers and students can solve together in the field of sustainable development, broadly defined? And then our researchers developed the training program starting from Mexico, and we got our students and researchers to Mexico, and they had experiential learning opportunities with the organizations and the industry partners that we have interviewed. So they can work with them, they shadow them, and know where, have their own bicultural, bifocal, binational understanding of the issues. And then after training, with a period of hybrid collaborations, we brought the researchers and the students to Northern Arizona University campus with continued training, but also collaborative problem solving. After that, our cross-national team of researchers and students presented their research results in the community organizations and industry that will work together both in Sonora and in Arizona. So that's a model that we can certainly expand to more professions, and especially health professions. Even with all the presentations that I have heard and admired this morning, we need to think broadly, not only in medical services, but also in public administration, policy institute, economic policies, and interdisciplinary, binational, cross-cultural kind of training and research teams grounded in community organizations and industry is critically important. And we all have opportunities to do that all together. With that, I will get into some of the models, expanded models that we can incorporate our partnerships from education to workforce development to professional development. When people come to me with the models of collaborations, the questions generally fall into 3 categories. Category number 1, how can I bring some talents from Arizona to my organization, an organization that is outside of the United States? How can I bring some talents and students to work with us together, either for problem solving, for cross-cultural teams, or just for professional development? And the second kind of question that I always receive is, how do I bring my employees or my students to the United States and earn your degree and work with your students with minimum cost and also with local engagement, right? And the third kind of question is, how do we do real, meaningful collaborations that address work-based problems, both in Mexico and in Arizona? And all 3 are really good, meaningful questions. And at the operational level, I would encourage all of us to start thinking about the purpose. By purpose, it doesn't necessarily mean world peace or solving all the health professional problems, that's part of it. But by purpose, I really mean that what is the goal you want to achieve, either as an organization or as a university or as an individual. And think about if we want to do a training program, where do you want the training to take place, right? And the example I just give had training in both Mexico and in Arizona. And of course, if the training happens in Arizona, if we want students and professionals to participate from Mexico, depending on the length and the purpose, visa is always part of the picture. Whether you want your students or employees to get our degrees on, whether it's a dual degree or whether it's a single degree. How long you want the training to be? 2 weeks, 2 months, or 2 years? Or it can be 3 years. And who is the audience? Whether you are thinking about students, now we start training them from, let's say, 3rd year of their college, or people who have already been working in your organization, or yourselves. And then think about finance, whether we can work together to get some funding at the national, international, or state or local level, whether you want the program to be really minimum cost, right? That's actually the goal for our program in 90% of the times, the minimum cost. One of the presenters mentioned how high our price rate is at the universities in Arizona, which is true. But there are always ways that we can do minimum cost kind of training together. With all that, I will give you some examples. As I always say, international partnerships, cross-border relationships are two-way streets. A lot of times when we think about workforce development training, we think about bringing people from other places to Arizona and let's train them. Well, that's only one of the ways. And again, for the researchers from Mexico here, and for the organizations and for the industry leaders here from Mexico outside of the United States. At Northern Arizona University, our number of study abroad students, especially long-term number of study abroad, ranks number 8 in this nation. And one of our programs is called Interdisciplinary Global Programs. In that program, students get 2 undergraduate degrees, 1 language, 1 any kind of profession, health profession, medical sciences, nursing, science, business, and engineering. So in this program, with all the languages, guess which language ranks number 1? Spanish. And actually Spanish takers now comprise of 64% of students in this program. And in this program, students do study abroad for a whole year, of which one semester as engaged experiential research, experiential learning, or internships. So we have been looking at very actively looking for opportunities for our students to engage in your organizations and in your research labs to learn from you. And not only for cross-border relations and if your research lab or if your organization locates in Mexico, but even with our local, our Arizona-based organizations, how great it is for our students to learn from you, learn good work you are doing. Again, not only in health professions, but also in public administration, economic policy, community engagement, volunteerism, right? And if you work with us and engage our students in what you do, it is really a good opportunity to develop the next generation of professionals that can engage our kinds of professions. And the next example that I want to give you is really bringing students to Arizona. The example I gave you, the project that was supported by 100 South and America Strong, was an example that of the short-term industry community-based professional training. With that, the sky is the limit, right? And we can really envision projects that can be grounded in any kind of topic with any kind of academic training, with relatively short-term period of time, without significant visa engagement, without paying Northern Arizona University international tuition, because it's a training program, and we can always start from there. And with that kind of programs, very sustainable, substantial collaborations in research, in education, develop right after that. And the last example I want to give you really involves some of the visa engagement. It is in the field of semiconducting area, but again, it can easily be expanded into other professions, especially health professions. Actually, it's much easier to be implemented in health professions. During the past year, we have received requests from multiple private universities in Mexico that wanted to do collaborative training for their students in the field of semiconducting industry, both with UA and Northern Arizona University. The request is, first, we want our students to understand the semiconducting industry in our local areas, like Mexico. We want students to be able to work in Arizona in the field of semiconducting industry, both while they study and after they graduate. And we want students to pay minimum tuition, and we want students to get 2 degrees, one from our university, one from your university, and hopefully both UA and NAU. Okay, with that, first of all, if students want to, with work, especially with health professions, I know we also have TN kinds of visa and other kind of special resident visas, but especially with education, connected with education. F1 visas, G1 visas are how students come to the United States. And especially if we want students to work in the US, especially in the industry that are connected to their academic fields, students have to be on F1 visa studying at least 2 semesters, spring or fall, semester 4 and spring, in an institution in the United States. So 2 semesters are really the minimum in order to get what we call OPT, optional practicum training. So once they get that degree, they can stay in the US for 1 to 3 years on OPT without the work visa to have work experiences. During those 2 semesters, before students graduate, they can be on CPT, curriculum practicum training, to really practice in the field of their own study. And if we're talking about master's degree now, 2 semesters is not enough to get a master's degree. If we're talking about undergraduate degrees, 2 semesters is also not enough. But after that, because that's a visa criteria, there's nothing that universities can do about. Beyond that, we can do hybrid programs. We can deliver some of the courses in country in your university with minimum cost, so that we significantly reduce the cost for students. And also enhances cross-national collaborations, because when we send faculty to teach, when we do on-the-ground kind of collaborations, it always also builds capacity from both universities. So now, here's all of you can come in. Whether you are representing an organization in the industry, whether you are representing a university, or whether you are representing or community organization, this is how you can come in. You can work with us, public universities, to think about not only to support students when students on these different kinds of visa-related work opportunities, either when they're on OPT or they're on CPT, or eventually if they need to apply for work visas. All the organizations, industries that you represent are eligible to do this with us, with public universities. This is how we build this education to workforce development and professional development opportunities for our students, for our employees together. One of the strong motivations that why I come here is because, especially in Arizona, in multiple states in the United States, but especially in Arizona, both in the field of education and in the field of medical services and health professions, there are HR companies that support students, employees from multiple countries, either Mexico, other Latin American countries, or any other country, on G1 visas that they support, not what real employers support, and then they charge very high amount of fees from people who want to work in the United States. That is number one, marginally legal. Number two, very high cost for people who want to have educational or research or educational opportunities in Arizona. Three, it's not a streamlined process, because again, if your organizations can do it with us, if the industry that you can do it with us, we can build the partnerships from the scratch, co-create from the beginning, and then support with a little bit of legal consultation, and from Northern Arizona University and our contract lawyer can certainly help you to do this, so that we can do it together, so that you can provide either the internship, paid or unpaid, or the work opportunities grounded in educational opportunities, and have that streamlined process for our students, for our employees. And I have 1 minute sign there, and working together from short-term program training to bureau degrees to hybrid to collaborative research, for sending our students your way or do the training and to solve certain problems in industries, any kind of collaborations we can do together. Think about the workplace need, think about international partnerships, and think about the different kinds of visa types and different kinds of support we can provide to our students, employees together. Sky's the limit for international partnerships. With that, I will leave my business card here. Reach out to me and think about which kind of the partnerships we can do together. I will stop there, and hopefully what I present serves as springboard for discussion for meaningful international partnerships. Thank you.
Thank you, Dr. Wayne. Next, we have a short as well question and answer session. If anybody's interested in asking any of the speakers that have gone so far any questions, I'd be happy to bring you the mic. If not, we also encourage you during the break to engage with the speakers as well. For right now, I'm going, as I see no questions, I'm going to ask my colleagues to help me with some small token of appreciation for the speakers that have gone so far. If you've been one of our speakers this morning, I'm going to ask you to please come forward. On behalf of the Planning Committee, a little token of our appreciation for our speakers. We'll take a picture. We are a little bit ahead of schedule, which is good. I want to remind you all that
we can do this all day long, right? All day long. All day long. One forward, other one backwards. Oh, whoa. Okay, we're not doing the Macarena, we're not doing some 70s music. But I want to bring up some key facts that were spoken earlier. I want to thank Dr. Robert Trotter for some of the comments he made. And there's been, it's like we paid people to say what they said to get us ready here for lunch. Words I've heard: collaboration, talk into action, the power of using data and reports, ensuring inclusion in perspective, health equity. We talked about and looking into tools into equity that come from the Department of Health Services, and tools that we can use to support understanding our communities. But there was something said that I thought was very powerful. Don't forget of hearing the narrative from those that you want to serve, and including their perspective in the work. January came up and talked about how we then connect with families. How do we tell families? There was conversation about the link between children's well-being and the overall economic success of our community. I call that a quality of life that we all want here, whether it be in Gadsden, San Luis, Somerton, or in Yuma. Dr. Arturo Moreno Soto, I thought, was very passionate when he talked about the need for action, the obligation to support communities. The perspective of universities just not learning, but putting into practice. Dr. Wang brought a nice example, and at the middle of that example is that we need to have purpose. That everything needs to come with purpose. Well, what I want to bring with you today, we can go back to the first slide, go all the way back to what family resource centers are. I want to be able to give you, there's a PowerPoint there that we should be showing called Family Resource Centers. All right, we'll get there. But I want to give us purpose today. And the goal of this lunchtime activity is for us to realize that sometimes we might be using both hands, but our purpose is in opposite directions. We all might be having the idea of how we get there, but the tough work, the difficult work, is to get all of those that hold an important piece in our community to flow in the same way, with common purpose. I think that work is even harder than rocket science. When getting individuals, adults, to buy in, to have unified purpose, and all have a perspective into the way our hands go together. Well, I want to give you something today that can be just that. And they are called Family Resource Centers. And here in Yuma County, guess how many we have? How many family resource centers do you think we have here in Yuma County? 0! Not one! And so you heard that I am a transplant. I'm originally from San Diego. My family is from Calexico, California. Very much the San Luis of California, out there in the Imperial Valley. They were very proud bulldogs. So my life stopped at the 111. But later in life, I learned that my grandfather, Ruben Ortiz, they would take the produce, when melons was actually a bigger crop here in Yuma than it is now, and then take it into Salinas for packaging. So there are roots here. But when I first moved here, I wanted to learn what Yuma had to offer. So I met with Amanda Gary, Maria Chaboya, met with different leaders over at AWC, and tried to understand what was going on here. I fully understand why we're in this building. Because sometimes you have to build where no other person believes you should build. So what I'm talking about today is building something that has been idea, but an agency has never taken the action to actually build it. But it doesn't need to be an agency. I don't know. So going back since 2012, there have been various Arizona town halls in our community. Have you ever been to an Arizona town hall? Raise your hand. If you have not been to an Arizona town hall, I challenge you to go to one. It is a great opportunity to be with diverse leaders in our community that come together around a purpose, around an idea, to take all those ideas and put them into one solid message. May it go to elected officials, may it go to community leaders. So I've been going to these, and out of the 11 of the 13 I've been to, all of them talked about this. In our community, we need a hub. We need a one-stop place. We need a place where families and citizens can go to learn about all the programs in our community. See, the health field does it really right. We can call them promotoras, we can call them community health workers, right? And as I've learned about the history of rural health services, the arts of that can be looked upon in this region of our state, of how we don't expect health to families that come to us, but we go to them, right? So how do we then put that into a way that it's just not focused on health, but that any family in Yuma, whether they're born, raised here, 7th generation, 8th generation, or if they're a transplant like me, if they come to Yuma, there's a one-place stop where every family and citizen can do 3 things. Next slide, please. Learn about the services in their community. Number 2, be referred to those services. And number 3, actually receive those services in that one place. What a dream. What a purpose. But purpose takes a process to get there. And I'm going to play this I think we got time. I got 5 minutes, Deanna. So we're going to play this whole video really quick. It's called The Power of System Building. So what I want to give you is the process in which you're going to hear from my intelligent, awesome, amazing colleague, Deanna Ortega, of how we are supporting that process of Family Resource Center. So please go ahead and play that video.
Children from birth to age 8 in one room. Every parent, educator, doctor, social worker, park district coordinator, business leader, policymaker, everyone. They'd agree every child deserves a caring and supportive community rich with opportunities for children to play, grow, and learn. And to make that happen, What if all the programs, agencies, and services for children were working together, making it so there was no wrong door for families to walk through when seeking support for their children? You'd call that wishful thinking. We call it systems building. Now, what do we mean by that? At the state and local level, a systems building approach helps partners connect and communicate in order to get the best outcomes for all children. Systems building builds on existing effective practices, from improving quality to engaging families.
All right, we can go ahead and
ensuring
pause it right
accountability,
there.
and
So the
promoting racial
idea
equity.
is to bring the whole community together with purpose, but using the perspective that every system partner has. Using needs and assets reports to really understand what the needs are of the community. Those that are actually working in the community to tell us firsthand what the needs are in the community. Like, I'm going to go on this tangent really quick. We use the word poverty a lot, and I've heard the word poverty a lot. But there's a difference when you're working with generational poverty or first-timer poverty. And how you work within those communities is how you differentiate success or failure. So it's very easy to stay up here and call it one thing, but how you actually support it and help it, you need the narrative. There are those that are being successful in those communities. You need that perspective to help guide your work. Next slide, please. So this is the purpose, my friends. We want to create welcoming, safe, accessible places where every family, every leader, every person here in Yuma County knows that I can go there and learn about all of the resources that Yuma County has. It's not dependent upon that I sit down with Amanda Aguirre, that I sit down with Maria Chavoya, or that I sit down with these different leaders to know what's happening in the community. It needs to be accessible. Like, I'll go on this tangent. Why do winter visitors know more about what's happening in Yuma than our own citizens? Because there's a group that makes sure that happens. Does that make sense? So our purpose is, can we join together so we give that same value to those that call this place home? Next slide, please. So what you have in front of you is a fact sheet that I didn't want to go over. You can read this on your own, but it talks about the power of when you create family resource centers, what you are able to achieve. Now, not only does it support local economy, but it empowers. It empowers family, and I've been hearing this, to have the knowledge to make the best choices for themselves, to make the best choices for their children. And at the end of the day, really going to what January was talking about earlier in her presentation, that if we care about Yuma County today, we take care of the family needs of today. But by doing that, we support their youth who is Yuma tomorrow. And I hear about this health care shortage of over 14,000 that are needed. And yes, I can see the health field trying to do all these initiatives right now. But imagine if the health field would have done this 15 years ago and started with growing our own here in Yuma. And so what I'm trying to say is, I'm giving this perfect example, and I'm not throwing it under the bus. But what I'm saying is, it's never too late to start with our youngest citizens in Yuma County. And the way that we do that is through their parents and who they call familia. And what it takes is, and what I'm going to bring now Deanna up the stage, or I'll have my amigo present Deanna because she is amazing. What I want to switch now is, we have purpose. We have people coming together that want to create this. And the beauty is, first things first, under this task force you're going to hear more about from Deanna, is actually achieving for us to get to that goal now. And our ultimate goal is to ensure that we have all the perspective to support its purpose to ensure its success. So my challenge to you, as we hear Deanna in a little bit, as she's speaking, I want you to look in the mirror, I want you to look at yourself, and I want you to look for the agency you represent and say, what can we do to partner with Deanna Ortega in this task force to ensure that our agency is supporting Yuma to thrive by investing in its #1 resource, not the crops. Our #1 resource, our children. Thank you.
Next up, we have Mrs. Diana Ortega, Program Coordination Specialist at First Things First Yuma. Ms. Ortega is a Program Coordination Specialist at First Things First in the Yuma region. Diana holds a Bachelor of Arts degree in Psychology from the Arizona State University. As a State of Arizona employee for 16 years, Diana has had the privilege to work with the Department of Economic Security, Arizona Healthcare Cost Containment System, and First Things First. Diana is a results-based facilitator and a dedicated coach who creates robust training curriculums and collaborative system-building approaches. At First Things First, Diana supports the Regional Partnership Council by coordinating efforts amongst community partners that strengthen and expand the early childhood education system. Born and raised in Yuma County, Diana is passionate about the success of children, families, and all Yuma residents. Please help me welcome Ms. Diana Ortega.
Hi, good afternoon. Next slide. All right. So Rudy set it up really nicely. What are we trying to do? We don't currently have family resource centers in Yuma, but we do have a passionate amount of individuals and partners who really want to come together ultimately to do what? We want a strong, we want a healthy community. And so what we really want to do is just raise awareness about what family resource centers are, using that collective impact approach, that system building approach, to bring us all together and stop working in silos. We keep hearing this. We all are doing amazing work, and if we just all come together and kind of fill in all those gaps to support the Yuma County community, we're really going to make it really strong for us. So I did want to talk to all of you about Family and Community Resource Centers Task Force. This is a group of individuals, like Dr. Trotter said earlier, who stop saying this is just a vision. We want to make it an action. And so a group of individuals, you see here an example, have come together and they do believe that we can bring family resource centers to Yuma. And perhaps right now we don't have a grant or we don't have funding, but we do have the talent. We do have the resources. We have a plethora of resources, in fact. We have a resource guide full of it, and a lot of partners have said, you know what, we want to do this together. And First Things First is only serving as the convener, as a facilitator, but we are really taking the voices of all the talent, all the individuals in our community, looking at data. That's one of the first things we did as a task force is, what does Yuma need? Because that's what we kept hearing is, yes, there's national models about family resource centers, there's even state models, but we're Yuma, and we want to make it unique to us, to what is needed here. And so this task force is a temporary group of individuals who are coming together. We're looking at data, we're looking at leveraging resources, and we're looking at putting together a pilot, or maybe a couple of pilots, of resource centers and make them very unique to the needs and interests of the individuals that we serve in our community. We do have a handout that's being passed out. Like Rudy said earlier, we just really want to ask you, if you're not already part of that task force, I do see some individuals here who are already part of it. We really invite you because we were doing that data walk, and one of the things that came out that was such a huge priority for our community is health. It was at the top. it helps. If our community is not healthy, we're not going to be able to raise education, to bring better circumstances economically, to boost our housing economy. And so if you saw, there was a graph where the task force does have some health professionals, yet it's still missing a lot of you. And so this was such a great opportunity to be able to come here today and just let you know that this task force is currently happening, that we are convening every month, and that we do need you. We need your expertise. And so if you want to learn more about it, if you want to be our supporter, we really welcome a meeting. We can invite you if you want to be more of a champion and really take on that hands-on approach to bring family resource centers to our community. You can scan that QR code, fill out your information, and then one of us will be in contact with you, and we hope you can join us. We're really looking to bring this to Yuma and make it really unique to the geographical area that these centers are going to be in. So are there any questions that you have for Rudy or I? Yes.
Thank you for that presentation on the concept of the resource center for family. Does it intend for the management period, the resource centers to be in different places, locations where people can give you access to a center there? I see the Somerton Center for us, the Center for Children with Special Needs is a resource center, always over that, where we have our staff, we can call, go to the salute, and can bring in resources and connecting families to resources. Is it the idea to have agencies that we can provide that kind of setting for creating those centers, or is it to build one center in every community in Yuma County?
The intent is, so the task force is only creating the pilot, so it might be one or two. But to your question, yes, ultimately the goal is that we're going to have resource centers in each of the Yuma County cities, because we know that if we build a resource center in North Yuma, it's going to look very, very different to what a resource center would look in San Luis. And so the really huge priority of resource centers is that you make it unique to the needs and interests of the community. And the geographical community is really important. So to answer your question, eventually, off of these pilots, we are going to create more throughout all of Yuma County.
I'm gonna add a little something. So the big vision, getting to the point, is exactly what Deanna said. But the big vision is that the task force just gets the action going. Like, you just can't talk about it. But the end goal will be that you would have a coalition of family resource centers in Yuma. And the coalition, you would have one or two representatives from the one from San Luis, one or two from Somerton, one or two maybe from Foothills, one or two from Mesa Heights, one or two from Yuma proper. And those individuals will come, look at the data, what families are looking for, share resources together. So at the end of the day, that collective and perspective are supporting one another to do what's best for their community. But as Deanna said, the goal is just to get this off the ground and flying, and then from there the task force dies off in a sense, and then we bring the perspective of who that backbone agency will be to carry on that family resource center and use it in a way that we're always including perspective so that we can learn from each other and then do what's best for that sub-regional community.
You know, very impressive to hear you say no family resource center here. But as we know, they've had them next door for a number of years, family resource centers in California. And I'm wondering, how are those financed? What's the financial support for those organizations that we lack?
So they're all over the state of Arizona as well. They're just not here. So it's first things first can be a funder of it. Well, why don't you just fund it, Rudy, and end it through first things first? Yuma, yeah. So Yuma has said we want to invest in programs to enhance the amount of programs that are not available and make this a community initiative under collective impact and hold the community accountable to be the infrastructure for it. So not wasting money that way, making sure that we have the programs to even fulfill the need of that FRC. But around the state, they can actually be funded by federal clinics. They can be funded by local medical institutions. They can be funded by universities. They can be funded by nonprofits. If you go to our neighbors in the West, some of the big ones that are happening if you say resource centers or community schools in the Imperial Valley, they think of court system schools. So that's a whole different dialogue. But when you go into San Diego, many of those are funded at a county level or even a city level. So they're part of the general funding plan that goes along. And all they do is say, we're a red carpet for all the nonprofits and all the clinics in the community to use the space for free.
Are you going to provide, or do you plan to provide feedback to every of the agencies that participate in this research center to let them know how are they doing, or how bad, or if there is any other area that they should cover?
The task force, you mean? To the agencies that are participating in the resource center? Yes. So currently the task force is a group of individuals, and we're starting to divide into action groups. One of those action groups is going to be the research and data. And so as we were saying earlier, it's going to be really responsive to the community that they're in, and that part of it is going to be data collection. And so it was really helpful to hear Ms. Alicia talk about how we report back. So we want to hear also from our community what's important for them to hear, what's important for those partners to hear. So absolutely, in the future, there is going to be a subgroup that is going to be collecting data and reporting back.
I'll end with this. The challenge for you guys to look in the mirror and see, can we have a role in this? The other challenge is really attend those Arizona town halls. They're impressive, they're awesome. The beautiful thing, because the Arizona town hall that happened, what was that, Linda? What month was it? Our last town hall, October. It was focused on this idea of family resource centers. We'll be able to provide an update of what's happening at the next one. And we don't know what the topic yet is on the next one, but there really will be an update. And I'm a dreamer, and Deanna and I, we talked about this. I firmly believe, put it out there and it will happen. A year from now, we will have ribbon cuttings for FRCs. I mean that with all my heart. People say, why do you stay in Yuma? It is because everyone wants to roll up their sleeves and actually get it done. And as Deanna said, as first things first, our role is not to take any credit here. We just heard it 85% of the time in these town halls, this idea was brought up. And we just want to be the facilitators, and I say we, it's over here. Deanna's been an amazing leader for us. We want to facilitate, and then as they move forward, just provide the technical assistance from our history as an agency, be able to fund these. But the beautiful thing, if they were only funded by First Things First, it would only be for families birth to age 5. And what we've learned here at Yuma, they want it to be spaces for everyone. So by doing it this way, we can make these FRCs, and I'm not throwing First Things First under the bus, that's what I mean. We can make them better than if it was just paid for by First Things First. And it can be Yuma's. And that's one thing I love about Yuma. We're very innovative of doing what's best for our community. So thank you to Deanna. I just give her a big round of applause. It's not easy to facilitate that work. But we hope that you're invited, and we hope that you take a stand, and let's start putting our families and little ones first, just like we do for our winter visitors.
Thank you, Rudy and Diana. Moving on to our next session, which is the roundtable discussions. It's my pleasure to introduce to you Dr. Steve Palmer, Professor of the Department of Health Sciences at Northern Arizona University. Dr. Palmer is a Professor of Health Sciences at Northern Arizona University. Dr. Palmer's primary research centers around physical activity promotion through physical education, specifically curriculum and pedagogical methods that contribute to individuals becoming and remaining physically active. Dr. Palmer earned his bachelor's and master's degrees from Chico State University in Chico, California, and his doctorate in curriculum instruction from Virginia Tech in Blacksburg, Virginia. Steve has worked at Northern Arizona University since 2001. Please welcome Dr. Steve Palmer.
Okay, folks, it's good to be up here. I'm excited for this next part of the roundtables. And honestly, Rudy and Deanna just kind of perfect segue into the roundtables. They mentioned purpose, those working in the community, really identifying the needs. Well, that's what this roundtable session is about, is for you to take the opportunity to identify the needs and even some solutions. Maybe make some connections that you hadn't made before to hopefully do things, whether it is finding ways to get involved with building family resource centers or something else. We can't wait to hear from you about this. So, the votes are in. This is not diminishing any of the 5 topics. They're all fabulous topics, but you all really overwhelmingly supported focusing our roundtable discussions around youth programming, supporting our youth, right? So we are asking you in your tables to have conversations about supporting your youth. There's research that's happening. Maybe there are research opportunities. You have programs and support services in place for those now. Maybe there are new ideas. So this is your time to please brainstorm and tell us or tell one another what you need and what you would like to accomplish, and then what the next steps are. So to do this, we really would appreciate you all taking notes. So we've got the laptops here. Please raise your hand if you're the one that is going to take notes at each table. We should hopefully have somebody at each table taking notes. At those tables, you should be able to log in. There's a link on the page to a Google Doc. If you could put your names in on that Google Doc and just keep your notes there and have some wonderful discussions. We cannot wait to hear and see what you come up with. If you need any technical support, just flag us down. We will get our tech folks to help out. All right, enjoy your conversations. We look forward to hearing and seeing what you come up with. If you take notes in Spanish, that is perfectly fine. Okay, so take notes in whatever language is easiest for you to share your thoughts. And what you come up with, we will get these out and post them on the summary page for this conference. So thank you again for your notes. I guess at this point I get to turn it over to Alex. So, once again, looking forward to seeing what you came up with and seeing where we are next year. Thank you.
Now moving forward to our closing remarks, it's my pleasure to introduce our next speaker, Ms. Amanda Aguirre, President and CEO of the Regional Center for Border Health and former Arizona State Senator. Ms. Aguirre, the first Latina and first woman to represent District 24, Yuma and La Paz counties in the state legislature from our area, presently serves in the capacity of President and CEO of the Regional Center for Border Health, Inc. since 1991 and its subsidiary, San Luis Walking Clinic, a primary care rural health medical center. Ms. Aguirre has been involved for more than 35 years in healthcare and business administration. She possesses a lifelong commitment to education, and in 2007, she established a licensed post-secondary vocational training center in the area of allied health training, which has generated job opportunities for over 3,000 individuals. Ms. Aguirre has built these corporations that have become multi-million-dollar corporations, providing employment for over 470 employees in a slow recovering economy. Ms. Aguirre also worked for Arizona Western College from 1995 to 1999 as a South Yuma County Campus Director. Ms. Aguirre has lived in Yuma, Arizona for the last 30 years, and her commitment to education is lifelong as she was raised by parents who were both elementary school teachers. With that, please help me welcome Ms. Amanda Aguirre.
Thank you, Alex. Muchísimas gracias a todos. Thank you, everybody, for coming today to this forum. This is the first forum that we've done in this type of setting where we have tables, discussion tables. If you remember, in the past, we had breakout sessions in different topics, whether it's education, workforce and education, that Linda and Mike had all the time, and then we had the binational group that talk about public health, and then we had the engagement, community engagement, and then research agenda. And today, you all were selected to see where you are seated. So I appreciate you following that rule on the number that you got given in the back of your name tag. But I think this collective approach of all of you representing different sectors of what we talk about and what we've been working on, I think gives a better perspective of what we would like to do collectively from the education, public health, from the community perspective. That many of you really talk about that as well as Dr. Bob Trotter mentioned it the same way. How do we all come to put in action the things that we have been discussing? Now, a lot of things has happened because of these forums. It's not like it's just been talk. I can tell you that a lot of us, a lot of the agencies participating, from public health to NAU and Yuma, Rudy, and everybody here have gone back and we put together different actions. And the fact that you are here today is one of the successes, because a lot of the work that we're doing comes from the heart of all of us. I always tell folks that we speak from the heart. And those that truly care about what's happening to the families in this region, not just Yuma County, not just in Arizona, but our friends and families in the Mexican side, San Luis, Mexicali, Hermosillo. I grew up, I was born and raised in Sonora. I'm a Sonorense. By life, I'm a US citizen. But nonetheless, what I learned in the border is that there's no border, right? Even though we have been divided for many events that happen, but nonetheless, the families continue united. Families continue crossing the border. The students continue crossing the border. And that's what makes a region so strong. Because nothing is going to separate us. We are united. And I think that you being here is what shows that drive and the passion that you all have. Because every time I talk to each and one of you, the passion comes across. Las llanteras que levantaron en Mexicali. The amazing work that all of you in all your schools and education institutions have been doing, or in public health, is amazing. And so that comes across. And believe me, we're all committed. I want to personally thank, first of all of you for being here and make this event very successful. Today, our guest speakers, they came from Phoenix, Alicia, January, a longtime friend of mine, that I can spend the whole afternoon talking about all the things that we did when we were under Governor Napolitano. Amazing work. Amazing work. All day kindergarten, right? Big time. First time ever funded. And many other initiatives that started back then.